Viva Isla Sen Para Gitodui Tempui Pas Paraita Dan Gini Langit na bendisyon Contrai peligro na fansafuham Deus protege Island Guam Contrai peligro na fansafuham Deus protege Island Guam.
Ay sinati untungu Tagihiti ningo puthagu Zatiwa saka hau zangin Undingu Lohuli hau gipayi Zahan lagu gi matamu Zahapat satu maski pabel sangan Lohti hongi telu Napon naputi du naipagu Ni guahu gagagi magagi fionmu Aku magiga bagang Sabi sangon ni istura Sahabu zamu Aku magiga bagang Sabi sangon ni istura Sahabu zamu Ay sinati unhongi Naikura sonmu ku makati Ay putagu Ay lohagu itelu Ay magay tinhasu Na putagu tu na neni na mapatu Long na karugi zagwahu Zan magay na tizamu Zabe hana zani na anu na dimumu Apu magiga pagahu Zabe sanga meni suram Sahabu zamu Apu magiga pagahu Zabe sanga meni suram Sahabu zamu Aku magiga pagahu Zabe sanga meni suram Sahabu zamu
Oh, well, Sabrina wanted to start the show with a little JD Crutch.
Love this song.
Oh,
Not bad, not bad.
I like the yellow face mask, Sabrina.
You like
It
it?
says Harvey.
Oh,
Yeah.
thank you. This
Yeah.
actually was made by my aunt in Oklahoma,
Wow,
and she sent it. So she sent a couple.
that's
so-
cute. Can you show
Thank
him
you,
that
Auntie
thing?
Annie. Auntie Annie Foster.
There you go. Sabrina's Auntie Annie Foster getting into the mask game and sending her a mask all the way from the American states. Where at?
Oklahoma.
Yeehaw!
OU. Boomer Sooners.
We are only like 2 minutes into our show, and judging by the comments, already Sabrina's mask is trending.
It is, yeah. And that's cool. You know, there's a bunch of people who make these on Guam. I got a few from the kids. And I think it's just one of the ways that we kind of make the most of our situation as human beings.
Hmm.
And good morning on you.
Good morning.
It is Tuesday, the 21st day of April, containing COVID, the KUAM News takeover of Guam's favorite. Shout out to our men behind the scenes. We have DJ Joe Sir, and of course, the one and only Jason Solis.
Woohoo.
And the show, there's just so many ways to get it, guys. Of course, right here on the radio where it all began, 93.9 FM, Guam's favorite. There's also an audio stream on Docomo Channel 10. And, of course, streaming live on the KUAM News app and at KUAM.com. And then at 8 a.m., we jump over to KUAM TV 11, where we finish out the last 2 hours of the show. And last but definitely not least, thank you so much for your interaction, your support, your shares, your likes, your comments, your questions. KUAM News Facebook Live. That is the stream. We ask that you know, if you watch it, it's real information, real time. Share it. Get it out there as we continue to kill this curve with COVID-19. And as we always do, we start the show with a deep dive into the day's COVID-19 news. So let's do it. From the KUAM News team, Sabrina Salas-Matanani. Good morning, Sabrina.
Half a day, everybody. Good morning. According to the latest from the Joint Information Center, the latest release coming down at 8:50 last night, Public Health tested 15 individuals for COVID-19 on Monday. 0 tested positive through Public Health, and of course 15 tested negative. Public Health's overall count includes probable causes, confirmed positive cases tested by Naval Health Research Center in San Diego, the Guam Memorial Hospital, and DLS. To date, 136 have been confirmed through COVID-19 testing, with 5 deaths and 112 recoveries. Now, recovery, it means a patient is no longer considered infectious, according to the U.S. Centers for Disease Control and Prevention and published guidelines. A patient is classified as recovered after at least 72 hours have passed without a fever or additional respiratory issues, and at least 7 days have passed since symptoms first appeared. All remaining cases are in isolation. Expanded testing for potential COVID-19 infections begins this week. Public Health plans to go into high-risk infection areas within the villages to test those with even mild flu-like symptoms. Here's more from Monday's press conference as Nestor Lecanto asks for more information about the new community testing initiative.
Can you tell us how many deaths in the last month are suspected to have been linked to COVID-19? We understand that several bodies have tested negative for the coronavirus, but there may have been a clinical diagnosis of COVID to have played a part in the deaths of these individuals. So how many bodies have been tested for COVID, and is there a definitive way to determine if a death was COVID related? And how do we count these cases towards the overall COVID number?
Governor, may I?
Go on.
We've had a case with a cluster that we have identified and linked one of the deaths with the Iglesia de Cristo Church. So that was one of the areas that we identified the death with the cluster. There are other deaths that may not be related to the cluster, and in that sense, it was just a spread that they either occurred through. Of course, they have uncompromised immunity, and also there was a case where we have a dialysis patient, and I believe that that was related because of another household member that contracted it through travel, and then that individual that traveled spread it to the mother, and so that's how the mother got it. It was a travel related. So again, it's classified as a cluster because it didn't originate from the mother, it originated from the daughter that came, and the infection occurred not only with her but also her husband. And so those are how we identify the clusters and how they continue to spread. So we've had several cases already with that. But in regards to the death, there's one that I'm very much aware that is related to that cluster, and then the other one was a household cluster. The other one was a church gathering cluster.
So can I ask what your question is again? Is it how are these bodies related to COVID?
Yes, because they're clinically diagnosed of COVID. Oh, sorry.
Yeah.
But they were also tested and they're positive for COVID.
Yes, so the question is, how do we count these cases towards the overall COVID numbers if they're clinically diagnosed of to be in part, are they in part of the death?
Yeah. So when you do the diagnosis that comes from the clinic,
There's
meaning
no
they're
death.
tested, that would be a confirmed case. When they're clinically diagnosed, it's classified as a probable case, and so they're separated. But at the end, they're tallied together for the overall grand total. So,
But there has not been a death that is a death that's clinically diagnosed as COVID. All the deaths, all the fatality has been positive COVID tested.
testing from the laboratory. Yeah. Because she asked about clusters, that's why she was trying to connect that. Does that answer the question? Adriana, does that answer your question?
Well, partially not. I mean, I'm more so concerned on how many people have died that may, even though they weren't, I guess they presented symptoms with COVID.
Okay, so when they're presented with symptoms of COVID at the hospital or even anywhere else, they're considered a person under investigation. They collect the sample, the nasopharyngeal sample, and then they test it. So everyone that's PUI labeled are either not positive for COVID or positive for COVID. So all those that did became a fatality are all tested as COVID positive. No, we're good. Let's move on.
And we're identifying areas where we know that all these individuals can be present and we'll have a good turnout, especially in these isolated areas. And of course, we've identified several locations in the northern, central, and southern regions, and we're already preparing for that. And if you want, I can be more descriptive, like the Santa Ana. There's a basketball court that we're planning to put out a tent and do the swabbing there. A Stumbo Gym, there's a drive-through on the back, and also Jigo Gym. In the central region, Manila and Tawini, where the homeless population resides, there is a senior citizen center there that we can do the drive-through. Agana Mayor's office, there's also a walk-through for our homeless. And southern areas, like in Agate, we have the Southern Visita, which is also a drive-through, and Jonya, which is a gym that we can also do a drive-through. So these are some of the areas that we've identified, and we're going to work with the mayors, as the governor indicated. We're already doing all the legwork and the logistics in that regards.
Governor.
Officials say they expect to be able to start conducting up to 250 tests a day and more as capacity increases. The governor says she will be listening in on the Trump administration's conference call today about reopening the American economy. She says each state and territorial governor has a discretion to decide when to reopen their local economy, and the governor says she will unveil more about her plan on Friday. The governor last week appointed an 11-person advisory team to help her decide when asked by KUAM News whether she would also be tapping former Governor Carl Gutierrez, who is her chief economic advisor on national and international affairs. She said that he would be looped in to the discussions. In news from the CNMI, Governor Ralph Torres met with Brigadier General Tracy Smith, commander of the 18th Medical Command Deployment Support, to discuss a way forward on how the Department of Defense can best support the CNMI in its response efforts to combat COVID-19. The 18th MC commander arrived on Saipan over the weekend with their team of medical planners to synchronize the needs of the Commonwealth with key medicines governors over who should be responsible for coronavirus testing amid the pandemic. This comes as the White House and congressional leaders say they are close to a deal to help the nation's small businesses keep employees on the payroll. Skylar Henry has more details from the White House.
Vice President Pence is headed to FEMA headquarters today, where he will video conference with the nation's governors.
We'll be providing all the nation's governors and all of their health officials with detail about the testing infrastructure that exists all around the country.
But coronavirus testing has become a point of friction between the White House and the governors, as President Trump says it's up to the states to get testing up to speed.
Testing is local. You can't have it both ways. Testing is a local thing.
To try to push this off to say that the governors have plenty of testing and they should just get to work on testing, somehow we aren't doing our job, is just absolutely false.
Governors say there needs to be a coordinated federal response to get needed supplies.
I can't do an international supply chain, and that's where the federal government has to help, because no state can do that.
The White House and congressional Democrats both say they are close to a deal on a new financial relief package that will include more money for testing.
But the majority of the money will go to small businesses, with an additional $300 billion for the loan program designed to keep employees on the payroll during the pandemic response.
That program's been incredibly successful. It's kept workers connected to their firms and made it so that as governors start to decide to open up their economies, that the people will be in place to do that.
The Senate could try to pass the package with a voice vote this afternoon. Skylar Henry, CBS News.
Association delivered 200 gallons of bleach for COVID-19 disinfectant cleaning to the Guam Memorial Hospital and the fire department. This will help keep their contaminated areas safe. And this goes out to, or big thanks goes out to the Lions Club, JFK class of 1980, as well as Mr. and Mrs. Romeo Angel, Miss Sumi Kuba, Mr. and Mrs. Richard Payne, and Mr. and Mrs. Jean Tennyson. That's it.
All right, thank you. 6:29, Sabrina Solis and Matt Tanani, as always, with a deep dive into the day's COVID news. And the big news yesterday, the impending community testing that's going to happen.
Yeah, that's going to be interesting. It's I think Linda mentioned a couple of places where they plan on going, some of the more isolated areas. Right. And I think she called them like high infection or probable high infection locations, which... I mean, I don't know. Gilbaza, that's what
I think maybe she said that. I'm totally guessing her, and I tried to get her this morning, but she's not available. Maybe because of the people live closer together. I don't know. We'll find out. But I got Dedido Mayor Melissa Savars on the line. She's also the president of the Mayor's Council of Guam, and as you heard there from the governor saying that she's working very closely with the mayors to roll out this I guess our version of mass testing, if you will.
Right. And this is actually a plan that was developed by Public Health.
Right. And so, Mayor, good morning.
Hi, good morning, Chris and Sabrina.
Good morning.
So I guess just start at the beginning. The governor said she's working with you guys to get community testing a reality. So where are we at with that, Mayor?
Yeah, so I spoke to the Department of Public Health. I spoke to Linda yesterday. It's going to be similar to areas, the way they kind of do immunization outreach, where they go out into areas of the community and, similar to the drive-through swabbing. If residents in that particular area feel that, they maybe feel like they've been exposed to something or feel that they have maybe symptoms related to the diagnosis of coronavirus, then they will make that effort to come in and have themselves swabbed. It doesn't mean that that's not being done already, because right now you can go to any private clinic, any primary physician, and they can do that there. Department of Public Health, both Northern and Southern health centers are already getting individuals that feel that they want to be tested and because of symptoms that they may have. However, bringing it out to the community and doing a drive-through process in areas that are kind of like not really isolated, but areas that where people maybe in those neighborhoods don't have the access to come to the Northern or Southern health center because of transportation.
Right.
So that would be afforded. What they meant by high areas, it's not that we have, Dedido, of course, having 41 positive, out of the 41, 26 have recovered. That's a high number for our community, but, pretty low because of the population that we have. So what it is because we have that high number, we would identify an area. Say if I do League One Terrace, if we choose to do League One, it's not because the 41 people that were tested positive for Dedido are all from League One. It's not that way. It's because of our high number, and we just need to maybe do a swabbing for interested individuals in the village itself. Mm-hmm. So those are things that we're still working out. Of course, having the number of test kits, making sure that the test kits are available for that as well, and then the team. The team is ready. I think we're just working out the details on what area we will start with. I did speak to several mayors to use their facilities, North, Central, South. That's what we're looking at.
So is it going to be every village, or is it going to be done in regions?
By region. because we're looking at common areas where there's a drive-through. So like if we're going to do something like in Manila, we have, or in Arahan, we already have the Arahan Community Health Center. So, we wouldn't do it in Arahan because already the facility is there as a drive-through. So we would look for another area in the south. So the other area in the south, which would be more convenient for the other side of the southern villages, would be the Agate area. I spoke to Mayor Sosico in Agate, so they can use the Agate Senior Citizen Center, can be used as a drive-through as well. So
and how does this work? Is it going to be mayor's staff, or is it going to be public health staff?
It'll be the Department of Public Health. The mayor's staff are not trained to do the swabbing.
Right.
It's actually the Department of Public Health team that will do it, and of course, they will be working. From what I understand, is the National Guard also has a team, so they'll be working with the TAG. That will be if they have their team that would be also ready to come out and assist in this process.
Mm-hmm. And I thought you wanted to ask something. So is this going to be when does it start for Dedido? And is it going to be a week? Like we're going to do a week here in Dedido, then we're going to go down to the southern end and do a week there.
It'll be a one-day process because we'll do an area in the village, and the people in that area can drive through the area. Of course, they're going to ask questions. We will take flyers and pass it out for that particular area. We're going to do a test area, like a pilot program in the smaller community. I'm not sure yet when. Of course, they're getting public health is getting together with their team to make sure that they have all their documents or all the necessary tools that they need to do this as an outreach.
Mayor, are we clear yet on what people who want to go get tested are going to have to bring with them in terms of like ID or any kind of like paperwork or?
Maybe an identification so they know who exactly they're working with, because of course when the results come in, they still need to get a hold of the individual.
Right.
Mm-hmm. Yeah. So of course a photo ID is necessary to bring with them.
Mm-hmm.
So and then like I said, this testing is already ongoing. Anybody that's feeling symptomatic, they can drive to either of the health centers, go to a private clinic. As we know, all primary physicians are also doing testing in their clinic.
Right, yeah, but
So
Mayor, I think the criteria they're using is leading to people getting turned away. We get a lot of comments where people say they show up at these places, they want to be tested, but, they don't meet enough of the criteria. So I think, now with what we're going to be rolling out in the communities, they've broadened that criteria, right?
Well, in the community too, through the outreach, you're still going to need to know. I mean, if you're somebody that doesn't have any symptoms, somebody that hasn't been exposed to anything or anyone, there are going to be some questions. The same way that Dr. Thane was also also said that even in the States there are questions that they're asked, and then if you don't meet any of these, if you don't answer yes to any of these questions, any say X, Y, and Z questions, then you'll go to the other lane. And so
how are you guys
there's a vetting process.
Dedido is, if we're doing it for the North, one day doesn't seem like it's going to be enough time when you consider you're going to have people from Chigo that are going to come down.
Okay, so in the North, it'll be Dedido and Chigo. So Chigo would have their own processing day, and that was my concern is, we just do Dedido and then Chigo had 13 cases, I'm sure that they would. So I did speak to them, and they said, yes, we can do Dedido one day, Chigo another day, because I don't want everybody flocking,
Right.
because Dedido is going to be the only North. Everybody flocking to Dedido because Chigo's not going to get done. So the North, the larger villages, we are going to do Dedido, Chigo, Minilao.
Mayor, so I'm just thinking, people, if they want to get tested and it's in Dedido, or is that only for Dedido residents or what?
Well, like I said, anybody that wants to get tested now, I mean, they can drive to the front of the Northern Health Center, fill out their, give their information, and then get tested. I'm not sure what's happening maybe for those in the private clinics if they're being vetted a different way. But in the health centers and of course we'll, I guess it doesn't stop anyone from coming from another village. Maybe if we're not sure if Tumaning is going to get on the schedule right now, because that would be more like a central area, then if they come to the area when there's outreach, then they can drive through, and it's a drive-through process. So, and for those, and it's going to be in an area where families in those neighborhoods can actually walk through as well.
So there'll be you can walk up.
Yes, so there'll be a drive-through and then an area. And so in it, as an example, if I do it at the Estumbo gym, where we normally do outreaches, there's a gate where they can drive through, but then there's a small gate where the neighbors can actually walk through, and then so the drive-through would go through the back of the facility, drive through that area, and then come out the back gate. The ones walking in would be coming in and walk through the front sidewalk of the building.
This sounds like a lot of traffic.
Well,
yeah, how are you going to do all that while still maintaining the social distancing? I mean, obviously that's going to be the challenge, right?
Well, social distancing for those in their vehicles, they're in their vehicles, right? And then we have the gym is a large area. The road is a 40-foot road easement coming from into the property, into the gym. We'll do it on a day where the school is not doing feeding, so we're not clashing. We're not
feeding Monday
working with it.
Yeah, Mayor. So are you saying it's going to be done on a Saturday or Sunday?
We'll probably do it on a weekend because we don't want to conflict with the traffic that's coming in.
Good call. I was just going to ask that.
Right?
Mm-hmm.
Yeah.
Good thinking, Mayor.
Okay.
So are we looking at this starting Saturday then?
I really can't say. We're just waiting on the team at Public Health and their team to see what day would be feasible to do this. And then, of course, we'll pass out flyers as well.
Is there
the immediate neighborhood would know about it?
Are you guys given a certain amount of test kits? So only like 100?
Yeah. We're not the ones bringing the test kits. It's all coming from Public Health. We're working at numbers because it's going to be a pilot in, I'm not quite sure which village we're going to pilot it in. I would want to do it in one of the larger villages and maybe start with, I don't know, if they have 100 kits available, let's do 100 and see and say we're going to do 100 tests, and so that's still what we're working out with Department of Public Health and their team.
Because it would seem,
yeah,
first come, first serve for the first 100, and then we're done.
Man, you're gonna have a lot of people going to be upset about having to line up. And Mayor, let me ask you. So I know that these clinics in the north and south, you keep saying they're already open for people to go get tested, but the governor and Linda are saying that people aren't presenting themselves to be tested, and that's why we're seeing such low test runs. So do you think that maybe people don't want to get tested because they're not sure if they're going to get thrown into quarantine, or do you think that us telling everyone to stay home is having the effect where everybody's thinking they have to stay home?
Well, maybe that could be it, and that was also brought up. What if we say we're going to do 100 and only 5 people come out? So it's about getting the message out, because we've seen outreaches and then nobody comes, or a few people, only a handful, and that's because when you ask them about it, I don't read the newspaper, I don't listen to the news, I don't have a radio. So in this process, when we're going to do it, we're going to actually pass out flyers in the neighborhoods of that area. So that's something that hopefully we can reach out for those particular neighborhoods when we're in there.
Well, what do you think, Mayor? Do you think people want to get tested for COVID-19, or?
If I'm symptomatic, if I've been exposed, if I still go out to work, then I would want to be tested, because, you're meeting, we don't meet people directly every day, but because we're in our offices trying to take care of things, but I would love to have my staff who deliver meals to the seniors, making sure that the seniors get their meals tested, because not that they have direct contact with the seniors, but they're working with each other as a team. Right. I have staff that still go out and direct traffic for the schools. for the school meals. I would like they're not in direct contact with the people coming to pick up, but they're out there in the elements. I would like them to be tested.
But they're only going to be tested if they have one of the mild symptoms, right?
Well, one of the things is there is a questionnaire that they will need to fill out. It's not a 3-page questionnaire. It's probably about maybe less than 10 questions. And if they answer, like I said, if they answer yes to any of those questions, they will be considered for testing.
Are these tests serology, or are they PCR or swabs?
They're swabs.
Okay, and these are rapid test kits. So how long does it take to get the results? When you're there, are you going to find out, okay, you're negative, or you're positive while you're there?
Because they still need to go to the lab to get tested, okay? So what happens is, I know that we spoke to somebody, how long, when they get put in the cooler, after their swab, they put their name on the test, on the tube, they put it in the cooler, and then they need to be taken immediately to the lab. The lab will test it, and I'm not sure what the turnaround is. I didn't hear that part, but I'm sure that it's within the day.
Mm-hmm. And the mayor's got a full briefing on all of this from public health, or is it just...
No, I went because I made contact with Linda yesterday, and I went to the meeting with public health yesterday. I attended a meeting with public health yesterday, and they're still working out the details on this.
Well, the gov said this week, though, right? So what does that mean this week?
They just need to get their test kits together and then identify their teams that are going to be going out. Because you need somebody to swab. Usually the nurses are swabbing. You need to know if we're going to have a walking line. I will take care of the logistics of the, because of people walking into the facility.
Yeah.
Okay? And it's not into the facility. We're going to be, I will take care of those logistics. I need to put the tape on mark the lines, to
every
keep the
6 feet,
distancing,
right? Yeah.
Yes. So public health will take care of their end as far as how many test kits they're bringing up, what kind of questionnaires. They'll be preparing a flyer so that I can take out with our team to pass out a few days prior to.
Well, one day though still really does not seem like it's enough time.
And Mayor, so is it going to be like one day this week, and then you're going to have another day next week until we, test a lot of people from Dededo, or is it just one shot? That's it.
I believe it's one shot for Dededo. I mean, depending on how far out we go to, if
I think we need to get public health and tell us what the plan is, because people are going to get really confused, because I'm sort of like not
and then
understanding.
also there needs to be a rollout, right, Mayor? Like we're here for you guys. We we want to get all the info out to our audience and let them know, hey.
Like I said, we will be passing out flyers to that, those neighborhoods as well.
And then we need a copy of the questionnaire too, Mayor, so we can, share it with people so they know, if you're not going to be tested, don't take the whole family to go line up somewhere for a couple hours.
Mm-hmm.
Well, yeah. Okay. So I'm waiting for them to give us the information so that like I said, my facility is empty right now. We're not using it for anything.
Mm-hmm.
Remember, we're in a shutdown, but it will be ready as soon as, it's ready. So we're just waiting on them to see what team is coming, and then
how do we manage this with people's expectations, Mayor? Because right now people are thinking they're going to go show up, they're going to get tested, but then you're kind of saying like, oh, we might only have 100 test kits. I mean, not quite
she's
the
just
mass
going off
testing.
of the information she's getting.
Right, yeah.
So
we're here to support. To support the outreach effort. Okay.
Is this this is for everybody, or this is just for those key villages that each mayor identifies?
No,
like
it will be open. So of course, if you're from Barragata or Jornia, and there's an outreach in Mangilaw, you can drive to Mangilaw. Okay, it's not going to be restricted to a particular village. We're going to do a pilot.
Yeah, I thought they were mentioning yesterday, or Linda was like, okay, so in Jigo, like Gilbaza, we want to test the people in Gilbaza and other small isolated areas in that village. But now it sounds like it's, well, if I live in Dededo and I want to get tested in Jigos today, I'm going to go drive up to Jigo, and vice versa. Is that your understanding?
Sabrina, it's wherever the testing is at, and like I said, even if they're from Manila and there's no swabbing being done there, they can always drive to the Northern Health Center
Mm-hmm.
and the Southern Health Center.
Mm-hmm.
As long as they fill out their interview, they get all the information, and the nurses say, okay, you do meet some criteria, let's swab you, okay? Then they get swabbed. And then those are for people that feel, oh my God, I have these, I don't know if it's high pressure or migraine and I've got fever with it. If they feel like that, or even just feeling not right,
Mm-hmm.
come down, go to either of the health centers and get tested.
Right. I understand that that's the commercial testing, and then they go through DLS.
Right.
Yeah.
We also have some tests that also go through the public health lab.
Mm-hmm. So you're still not clear on when all of this actually starts.
It's going to happen really soon. I'm
This week.
waiting. I'm waiting for them to say, okay, we're going to do it on a Sunday. Okay.
Mm-hmm.
Right.
Yeah.
Okay. Anything else, Mayor? I'm going to
Just
try
want
and get
everybody to be safe.
Yeah.
Safe. Yeah. Okay.
Well, good luck on the whatever's going to happen with this community testing, and just keep us posted. If you need anything, just let us know. We can also post it on our social media
Yeah, Mayor.
to get the word out.
If you want to send us that questionnaire, we'll post it up, and I think we should do that so we can kind of avoid a huge just traffic jam like we're seeing with grab and go and stuff, right?
Yeah. Okay.
Okay,
All
thanks,
right.
Mayor.
Okay. You're welcome.
Thank you.
be safe.
Okay, Mayor. Wash your hands.
I always.
Okay, Mayor. There you go. She's the president of the Mayor's Council of Guam, Dedido Mayor Melissa Savares. And I got Linda on the phone, but she has a conference call with the feds this morning. So we know you guys got a lot of questions about the testing. We're going to try and nab someone from public health to kind of stand in. But I think what's key here is that even though the governor announced yesterday that there was a plan to test people to increase the number of tests that we run to bring them out into villages, obviously that plan is not near finalization.
Well, I think really what happened was, I think if public health is in charge, then maybe Linda should have been given that opportunity to explain it a little bit more. At least that's just my take.
Well, she did try to explain it, but then the governor, and I think that's
Yeah,
kind
I
of something
think,
I
yeah.
want to bring up is,
I think we need just time for Linda to just kind of just
I think
explain
Linda
it.
should be doing her own press conference, because when she starts to answer these questions and the governor interrupts her, and then Linda kind of, I mean, it is what it is. You watch the body language of these guys, it almost seems like they don't want to say anything that could be construed as negative around the governor. And you see she'll jump in and she'll be like, oh, can I add something?
Yeah.
So, I mean, no knock on the governor. She is the governor. But at this point, I think that, we need to let the experts talk, and we need to let the experts answer the questions. Because we asked a question yesterday about this, something we've been trying to track down is the deaths that were classified PUIs either, before or after. And it started like Linda was answering the question, and then the governor interrupted, and it just went all
confusing.
Haywire. So, I mean, I know the governor wants to be up front in this, but at the same time, I think she's got to kind of let the experts answer the questions.
Yeah.
Jason?
Okay, I did want to shine a little bit of light on some of the questions and comments we're getting right now, because some fantastic side discussions when Mayor Savares was on. Yeti Matanonia was actually asking before the mayor actually answered it. She said, are there going to be some kind of flyers that will be passed out, kind of in the same way that flyers are being passed out right now at the different roadblock points. That is part, it's part deterrence, it's part, public safety initiative, but it's also part educational campaign. So, they're actually in favor of that. And Rose Matanonia Lujan says, in
I don't know. I'm just kind of like, I don't know how many hands have touched that paper, so I'm just concerned.
Well,
about
exactly.
that,
And I mean, and our own take on that would be, there is no bigger communications network today than Facebook. So, and I like what you guys said. If the mayor gives it to us, we'll make sure it gets out there. And, it's all digital bits, so nobody's going to touch it. You're not going to transfer, any bacteria or anything funny. Yeah,
got
exactly.
that.
So Rose Matanonia Lujan also said, and, I'm Dedido born and raised, right? So I have a soft spot in my heart for this comment. She goes, in Dedido, they should use the PA system announcement as well as around the area. And if you're from Dedido, and especially like in the Lent season, what you saw is over at the Santa Barbara Church, they were announcing Mass every day. And on a good day and on a day when everybody should be off the road, which you should be right now because everybody stay home, if they broadcast stuff from the Santa Barbara Church, you can hear it as far away as Machechi.
Right.
So that's a very good plan. And you remember, Chris, like people like us that grew up here during the typhoon eras of the 90s.
Yeah.
The mayors would go around and they would have bullhorns on the back of their pickups.
Yeah.
All day long, and they would just tell people, like, hey,
We
stay
also
inside.
gotta get that. Let's get that guy who drives around blasting "Still the One" on his
Yeah.
little bullhorn. Let's enlist this guy, deputize him. You're right, Jay. I mean,
Dude.
we're gonna roll out this plan. It kind of seems like they just thought of it yesterday, maybe. But let's go for the execution. We're just here to help. We got an audience. We got a platform. We want to get this info out as soon as we get it. And so you can tell, obviously, with Mayor Savares that things are still rapidly developing.
Yeah.
Is that a nice way to put it?
Sure. Sure. At this point.
We'll take what we can get. So, when we can get a hold of Linda, she's always very, very thorough in answering her questions. So she did commit to tomorrow morning, but I don't know, maybe in the meantime, in the interim, we can get maybe Sean or somebody from who's kind of helping with that.
He might be in the meeting too.
Right, in that public health response. Jason?
Oh, sorry about that. As we just discussed that, people are saying already, I don't want to touch flyers. We got a couple of comments in there, and they're saying,
Yeah.
good idea, Rose, about the PA system. I mean, because it's in Santa Barbara, that covers a very big part of Dededo, but obviously Dededo is the second largest village in our on our island, Jigo being the first in terms of landmass, but it definitely is the most populous. So you can get the word out to a very large part of Dededo, but there are fringe areas, and of course, not everybody is on Facebook. The government, assumedly, is going to put this on the public health website, so go to dphss.guam.gov. You can find it there. We're going to put it out there the moment we get it. We're going to make sure you guys get it there, but this is a two-pronged problem right now, because one, you've got the physical logistics and trying to get all the human resources and trying to get people in the same place, socially distant, time and everything like that. And then you've also got the communications issue, which is trying to make sure that the stuff gets out.
Right.
Yeah, but people are saying, flyers, good idea. I'm not really okay with touching it, but they're saying.
Well, we have, the social media, obviously, I think is going to be key. Anything we get, we got the form from Daphne for non-filers. We put it out there in a downloadable form. So I think this is where the administration really needs to partner with the media, and let's just do a full-on assault. You know what I mean? We've been offering our platform, our services, every week we renew the call out to the administration and the officials that are leading the COVID-19 response. So the platform's always here. You guys come in, let's just get that info out, and I think we could do this, Bree.
Yeah, and even Yeti Manzanonia, did you guys read her comment? She had a good comment. We post it, and then our viewers, like herself, can share it and just spread the word, faster.
I mean, not just us. Let's get all the media involved here, and let's do it. As soon as we get info, we'll get it out to you. And it was really good to get Mayor Savares on to find out, because the governor had said, hey, we're working so closely with the mayors, and it did look like she had a lot of intel and info for us.
Mm-hmm. Yeah.
Hey, it's 6:57. We'll take a little break, and coming up, we've got Dr. Felix Cabrera from the Governor's Physicians Advisory Council. Also going to hear a little bit from the Republican Party of Guam. They had a release, Give Credit Where Credit Is Due. Boy, if we did that, politics wouldn't be any fun. But we're coming up with the former Senator Tony Ada from the Grand Ole Party. Also wanted to get Michelle Armenta from the Vigilance Committee, and that there was a lot of people wondering about what clinics that people had been exposed to COVID in, and through a Freedom of Information Act request, the Vigilance Committee was able to obtain that info, and we'll get Michelle on to talk about that and public health's efforts towards transparency. Okay, it's 6:57. This is the KUAM News Takeover of Guam's favorite I-94 containing COVID. Good morning.
Be healthy. Be informed with ITD. KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafaday Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Self-storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Specialist Joshua Mansonaut here. I can't wait for him to come home. Keep us safe and stay home.
I miss my daddy, and I can't wait to see him. So keep us safe and stay home!
Top of the day, everyone, and hello mga kababayan. Nestor Lecanto here from KUAM News. Just wanted to remind you all that we are in the midst of this battle together, this war against the coronavirus, COVID-19.
Tabulate that first, Jay. How many days? So we can just I could go on and be like, day, whatever it is. 21st day of April. It's a Tuesday, 7:05. Let's go over to the phones. Just trying to get more info about the community testing. Well, of course, we had Mayor Savares on, and one of the doctors on the Physicians Advisory Group, a regular to the show, Dr. Hoa Nguyen of American Medical Center. Good morning, Doc.
Good morning, Chris. Good morning, Sabrina.
Off today.
So I guess first of all, I want to ask, what do you make of all of these zero positives? I mean, we make the joke every morning that, I bet you there's going to be zero positives tonight, and I've been right. I mean, we should start a pool or something, Bree.
Yeah, so far, we are doing good. At the clinic level, we see our census are going down on the patient come in with cough and cold on a symptom of COVID-19 for the past probably 10 days or so. But we should not let that let our guard down, because the Easter weekend just last weekend. So this coming Sunday is very crucial because it's 7 to 14 days out. So we keep our finger crossed that the trend continue.
Doc, the governor and Linda had said in the press conference that people just aren't presenting themselves to be tested. How accurate is that?
That's might be the reality. A lot of people might be, listening to the message that we've been passed on, several weeks now, that if you have, cough and cold, any type of illness, to stay home and isolate themselves. And that's a high possibility. That's the reason why we see less patients in the clinic at this point, that people decide to stay home.
Right. So how many of these people you think are staying home that are really sick?
We still do a lot of phone triage, guys. The people, patient call in and they ask advice on what to do when they have cough and cold, and so we basically advise them to stay home. So the phone message is still there. It's just that the visit, the clinic visit is down. So that's good. Like I say, this weekend is about 2 weeks out from the Easter weekend. So if the trend are coming down, then I think that the island, we did the right thing. But again, we still need to keep our guard up rather than have a rebound like other places does.
Right, but I think that a lot of people are hearing this conversation and seeing that we continually get zero positives for COVID-19, and then they're also hearing the governor talk about reopening the island. So how do we kind of balance that conversation, which is taking up a big part of the landscape, and what a lot of you guys are saying? It's like, hey, let's not let our guard down. Let's take this serious. Because it does seem a little bit of a mixed message.
Yeah, the other place in the state, they, so quite a few places are trying to open back up a little bit at a time. The governor have a hard decision to make, to open too early for owner business. You might see a rebound on the island, but I think sooner or later, the governor will have to open, but probably in piecemeal. I know she have an advisory committee to try to put a plan together for our island here, and I think the plan should be released to the public pretty soon. But like I say, it had to be planned and staged, and not everyone open at the same time. But we still have to practice, the social distance and use the mask and hand washing. That's a big key that we need to put out in public. We need to continue to do those things.
Doc, when we start to do this community testing, and I think the commitment, did the governor say they're going to test 250 some people a day?
According to Nestor's report, it said that it was going to start this week, and I think it was up to 100. I don't know if that was a day.
Doc, what did you hear, Doc?
Yeah, I listen as I read the thing. that's our ability to do the test. That's the number in the bone part. But are we going to swap, 250 per day? I don't think so. It's really, we have to not go out there and do mass testing, but kind of target testing certain social groups, certain area. It'd be much more effective, to go out and swap everybody in the street. It's not going to be effective. So I think the number is there. They just need to come up with a target group to go after, to isolate those target group and try to prevent it from spreading out throughout the community. So I think that's just a number that they put out, but I think there's more plan to who they're going to target to be tested.
Now, how do you determine who you're going to target to test? Who determines that? Public health or the mayors or?
No, the public health, they have a lot of data. We know that who's coming from, the Filipino, the Chamorro, the Micronesian. There's certain target group there, and where it's coming from, the cluster they identify in the past. So through the tracing and the contact and the tracking, they probably know which target group they're going to go after. So, and with the help of the mayor, and there's a lot of people who put input in there, but like I say, it's a target group and not go out there and just have a drive-through and everyone testing.
Okay.
I don't think that's going to happen.
Okay, because that's kind of what the mayor made it sound like. They were going to have testing available, drive-through testing in Dededo. There's going to be one in the southern part of Guam. There's going to be one in Chigo, Manila, and more than likely on the weekend. And if you want to come and get tested, come on, drive through. That's kind of what it sounded like.
Yeah.
And it didn't seem like that was right.
And Doc, let me just read you a soundbite from, and this is a verbatim soundbite. Officials, well, it's from Nestor's story.
That's not the soundbite, that's the lead.
Okay, so they're expecting to be able to start conducting up to 250 tests a day, and more as the capacity increases. That's the info that we got from the press conference yesterday.
Yeah, but like I say, that's a capacity. But it doesn't mean you're going to swap that many people per day without having a valid reason, like I say, target testing. You just don't drive through, and that's a lot of paperwork, a lot of info you have to collect in order to identify who you swap and how you're going to contact them. So it's a lot of work. I know public health, some satellite clinics here, just like in Barrigada and someone else. But people can go there and request a testing, but a drive-through, just like in Cyclone, it is a nightmare, and I don't think they come up with a plan how to implement that one yet. So like I said, it's not a good idea that to use the test as the test still kind of limited, a number increase from a few to 20 to 40 to 200 plus. But like I say, it takes a lot of time, a lot of preparation, and a lot of protection for the healthcare worker to do the swapping. So it's going to be targeted. It's not going to be a mass testing.
Have you seen this plan, or is it still being written up?
We have a meeting tonight. And that's the thing that I will bring it up. We didn't have a meeting on Sunday, so tonight's the meeting, and that will be one of the questions we're going to brought it up with public health and try to, help them, come up with a plan to do this testing.
Right.
As we, like I say, as we have more test kits coming in, we have to use it in a way that it makes sense.
Doc, can we just set up something for tomorrow morning, maybe a debrief of the meeting tonight?
Yeah, we can try. Like I said, nothing promising to you, but like I said, we're going to have a few more issues to work up with.
Yeah.
To advise the governor on moving forward. So, we give you a brief breakdown what's going on.
Yeah, appreciate
What
that.
about a new trajectory? Are we going to see that come out anytime this week or next week?
The trajectory we have is, like we said, we really followed the FEMA model. And like I say, that's just like anything else. It's a model, and we continue to do what we do. That means that we are doing very well. But like I say, times will tell the next few weeks or so to see if we are beating that model or this is temporary, low point, and then it might pick back up again. We don't know. So like I say, we do a very good job in social isolation and social distance and masks. So we have to push those points all the time now.
Doc, I wanted to ask you, this is something we talked about last week, and we tried to ask it in the press conference yesterday, and it looked like Linda was starting to answer it, and it goes back to what we had discussed about deaths where they believe it could be COVID-related. They swab the body, it comes back negative for whatever reason, but that there's some type of clinical diagnosis on this. I'm just trying to track this down. This is something we heard from some sources. And we had spoken to you on it, and you said that, yeah, it was possible that we have had people die of, COVID-related issues, and that we're not counting it. And is there a way to go back and look at those and maybe get some numbers, or what are your thoughts on that?
Yeah, I know. What I know so far is that, any type of DOA death arrival to the hospital, they test them all. And so far, all the DOA is basically a negative for COVID-19. Okay, so any type of death, even in the hospital, they do test the patient, make sure they're not COVID-19. And so far, I'm not aware of any. And people called yesterday and say we heard there's 5. I told them, it's a rumor. There's no sense of public health or anyone trying to change those numbers, because those are reportable and by law. So you cannot kind of change the number and hide it. You have to report that. So when they say that clinically COVID positive, mean that the test is negative, but the patient presents a symptom just like COVID-19, so you presume and treat them like COVID-19. And there's 3 of them that I know, but the rest of them are positive. So any death that is COVID-19 that we don't know, they test all the people that are dying, and so far it's negative. There's room for missing? There's always room for missing, but it's not on purpose.
Right. But, can we really hold up these negative results? Is there something with when you test these bodies? Because I know nothing about it, and, it's just something we're trying to track down. Can we really hold up those negatives? Because we've seen false negatives in these cases, the probable cases, where they get a negative, but then they're clinically diagnosed. So I'm saying the precedent is there.
Absolutely. That's why, the funeral home is very careful and handles any type of dead body at this point for a funeral. They have to presume even if it's negative. So, but like I say, there's a chance that there's a false negative there, but we wouldn't know. Like I say, is that's not intentional by anybody.
Right.
Just that it is negative.
Right.
Okay.
Okay.
So we keep our finger crossed that the census is continue to be low. Like I said, in the clinic-wise, we kind of act like a pulse of the virus. So I can tell when we get busier because the people that come to the clinic and present the illness, or we don't see any. So we can feel it at the clinic level to see if this is trending downward or upward in the next few days.
Maybe people, though, are just because they're being told to stay home, they're just too scared to go into the clinic and get tested.
I would be scared. I would be like, I'm just going to hang on and try and beat this thing.
They call our hotline. On the big clinic, AMC, SDA, and FHP, we have a hotline to call in. And also, the public health also, they have their hotline. So we track by the number of phone calls that people call in and leave a message to ask what to do if they're ill.
So are you guys seeing a lot of phone calls, or you're not?
Well, we see some phone calls, but not as much as before.
Okay.
Yeah, I can tell you that. Yes,
Okay.
Not as much as before. So
Because you know how it is, like, I have a lump, but I don't want to call. I don't want to go in because they're gonna tell me.
Doc, I don't want to ruin your vibe, but people they don't really like doctors. They're kind of scared of them.
I know, but like I say, they still are nervous and they still are scared about this COVID-19. So sometimes when they scared, they still can call in and like I say, if they call in, most likely, if they have any symptom that we're concerned about, we just tell them to stay home.
Right.
And they need to call in.
Well, maybe that. But when they hear that though, and they're like, "Oh, if I call, they're just going to tell me to stay home. Why should I call?" But
Yeah,
we're just saying, guys out there, if you're feeling sick, call the clinic. Okay, call the clinic. Don't try and just hunker down and put 5 blankets on yourself or whatever.
The most important thing is, Chris, is that hunker down and stay in your room. Don't associate with your family members.
Now I got to do a new one. Stay in your room.
I did want to go back to the community testing. Is that free? Or are people going to have to pay for that?
For which
when we go out and we start testing,
we have people asking, is that
it's free. It's totally free. What the advisory committee that we tell is that everything regarding COVID-19 testing should be free. No one should be charged for it.
That's how you market it.
Yeah, this is time where it's not to make profit. It's basically to try to isolate and identify these people to prevent the spreading of the virus, and it should be free for everybody. All the insurance are paying, Medicare are paying, so no one should be charged at all. Nobody that comes to the tier 2 clinic get charged for zero as they go in and out and complain of a type of COVID-19 symptom. That's the service that provides to the community, and like I say, all testing are free.
There you go. Doc, anything else in closing that you'd like to add? What would be the single most important piece of information you could say to our listeners?
I think all the listeners, again, you got to use masks everywhere you go. You got to wash your hands. You got to, social distance 6 feet. If you go shopping somewhere for food, please go by yourself and not bring the family. Okay. And I know the roadblock is sometimes inconvenient, but it does help a whole lot and gets your life back to normal again. So we need to continue to do that even when the governor relaxed the restriction. Face mask and social distance is the big key to prevent the spreading or the recurrence of like the second wave of this virus. Okay?
Yeah, that's what something we're concerned about too. Is that we've seen it in other places that are fighting COVID. This it comes in waves.
Yes. So, but we can beat that. Everyone does. Everyone is a soldier in this one. So we have to abide by those rules. And again, even after this thing's over, I don't think the use of masks and social distance is going to be the abnormal. It's going to be the norm for a lot of people.
Doc, I was thinking last night, as I often do before I go to sleep, thinking back a couple years, when you see these tourists wearing the mask, and as a local, you're kind of like, what are they wearing the mask for? Now it's like they were onto something.
Yeah.
Yes, and they honor something. And like I say, after this one, I think that's going to be the norm for a lot of people.
I think so.
I know what I'm giving away for Christmas this year.
I think I look good with 50% of my face covered. It's a good look for me.
Yes, okay.
Okay. He's like, okay, where's this going?
Yeah.
Thank you, Doc.
You're welcome.
Okay,
Wash your hands.
Hey, guys.
Hang in there, Doc. Appreciate it. Okay.
Thank you.
All right.
Okay, bye-bye.
All right. There's Dr. Ahoa from the American Medical Center. Yeah, thank you, Doc. Important advice there. Jason, yes, good morning.
Okay, so community testing is, of course, the big theme today. It's what everybody's talking about in our comment stream. And we did put up a poll. It's on Facebook right now. I know Chris is looking at it. It's also on Twitter. So whichever social media you are on, make sure to vote. And we asked, how would you most like to receive information about community testing in your village for COVID-19? Now, we've got 4 options for you. We talked about these earlier, right, before Dr. Nguyen called. Would you like to receive them as flyers or possibly handouts going door to door? Would you like to receive them in social media, on Facebook, on Twitter, on Instagram, various forms, and from news outlets? Would you like to receive them possibly from your church public address system? If you live if you're a parishioner, would you like to get them so you're in the safety of your home and the churches would announce them? Or would you like the mayors to go around and do what they normally do after really bad typhoons and have a roving bullhorn? And at least from the initial votes that we've gotten, because you guys have been putting them in, overwhelmingly, people want to receive it from social media and from legitimate news organizations right now. We were talking about this earlier, Sabrina. We said, people are like, they're skittish about saying, even though I trust the National Guard or my mayors and everything like that, I don't know if I'm going to put my hands on a piece of paper and store that in my house, or, put a magnet up on my fridge after somebody's touched, a physical thing. So passing this around social media, obviously, is a lot faster. You can then share it to your own friends and family. But Church PA System's got a few votes. Roving Bullhorn from the mayors has a few, but undoubtedly 90% right now of those 4 options, people want to get it over social media and from those of us in news media. So we're doing our job. We want to know what you feel on this. So make sure to go right now on Facebook if you're on the mobile app or you're viewing us on a desktop computer. It's at the bottom of your screen, so please vote. We want to see what you think about this.
Thank you, Jay.
Thanks.
Yeah, please go vote, because Boboy went and made that poll for you guys.
Boboy.
Boboy.
We're the same age, bro. We're the same age in high school.
I know. It's just,
I appreciate that.
Okay, yeah. It's a compliment, Jay. It's a compliment. 7:25. Hey, coming up, we're going to keep the white coats coming. Dr. Felix Cabrera from the Governor's Physicians Advisory Council. Is it council or group?
Group.
The group. So he's coming on the show, of course, and what we're going to really try and ask him a little bit more about. Obviously, everyone wants to know about community testing, and that's kind of going to be the hot topic here. It's containing COVID, the KUAM News Takeover, Guam's favorite. Good morning.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with ITD.
Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafade Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Specialist Joshua Mancinopia. I can't wait for him to come home. Keep us safe and stay home. I miss my daddy, and I can't wait to see him. So keep us safe and stay home.
Be healthy. Be informed with ITD.
Top of the day, everyone, and hello mga kababayan. Nestor Lecanto here from KUAM News. Just wanted to remind you all that we are in the midst of this battle together, this war against the coronavirus, COVID-19. And just wanted to remind you, one of the best things that we can do to fight this is to wash our hands. I saw something on TV, and you need to do this for at least 20 seconds. You can maybe sing Row, Row, Row Your Boat or Happy Birthday a couple of times, but make sure you get everything. Get the top of your palm, your hands, the bottom, your thumbs, in between your fingers, and you can even use just regular soap and water. But just wanted to remind you that we're all in this together. We're going to get through this. And finally, stay home. That's very, very important.
Be healthy. Be informed with ITD.
This is Containing COVID. Good morning to our Facebook viewers and listeners. Thank you guys. Please watch and share the broadcast. 7:34. Let's keep it going here with the doctors. We'll bring on Dr. Felix Cabrera, Dr. Doomsday. Of course, from the Physicians Advisory Group. Good morning, doctor.
Good morning, my sunshine.
There you go. Yeah, we're your silver lining. So, I guess just first of all, Doc, we had heard yesterday that there was going to be a new trajectory coming out, and we heard this from Frank Mansell of FEMA, right? And so he had
kind of
said-
merging, right? Of
right,
the,
or there was something where he said that we were going to come out with a new trajectory in the next couple of days. And then we said, well, is FEMA involved? And he said it was more on you guys. So what can you tell us about that, first of all, Doc?
Sure, yeah. So we've been working very, very closely with FEMA, in particular the Region 9 office out of San Francisco. And the key part here is that they are working also with the CDC and Johns Hopkins Applied Physics Lab and in creating these models here. So they're using a lot of the same basic concepts that we had done locally, but applying it to a much more powerful calculator. And we've actually, since we actually been having morning Zoom conference meetings with them over the past 3 days even, and trying to keep refining the model even more and more. And so we got to a point where we felt pretty comfortable, and so you essentially won't be seeing any models that come straight from the physician advisory group and the state surgeon's cell. And instead, because we're merging and we're adopting FEMA's official model. And so that should be coming out shortly. Basically, the bottom line is that it shows two different types of trajectories. One is really the absolute best case, and then the absolute worst case. And they're completely polar opposites. But mainly these models again are used for planning purposes, and it's not necessary to be a forecast. Like to keep reiterating. So that's really what it's being used for. It's being used for FEMA to help make certain decisions as well, and then also for us in terms of how we would need to use these models to help make some policy decisions as well. And so we're actually excited about what we have in terms of having more reliable data.
Doc, how much of or how far a departure is this new model that we're going to see from the models that we saw from the Physicians Advisory Group?
Yeah, I would say this. What the model shows is that we have been extremely effective. And when I say we, I mean everyone on Guam. And that everything that the governor has done to ensure our safety and implement these orders, they very much show its effective measures, and then everyone's cooperation and also their individual efforts and innovative ideas to really help out in their own way. It really has made a tremendous difference, but it's still extremely early, and I think we've made it through this first round, this first phase, and so now we're on to the next phase.
And if we could just stress to people that these trajectories, they're a look at the past 2 weeks, not right. It examines.
Yes.
Right.
Yes. It takes into account basically the past month.
Okay.
The data that we've had over the past month. If you recall, it seems like forever ago, but the very first time we made a presentation during the governor's conference, that was even the first one was over at Homeland, and that we had basically barely anything to go on.
Right.
We were really flying blind. It was a flint in pitch darkness that we finally got a glimpse of what we might be facing, and then a week later or 2 weeks later we had even more data, and then it showed us how big this monster really could be, and that really scared everyone. And I think the one time that fear is really important for our survival, I think it's worked, and I think everyone used that fear in a productive way, and I think that's why we're seeing what we're seeing right now. But it's still extremely early, and at any point if we let off our foot off the gas too quickly, we pump on the brakes in terms of our efforts, we will see this monster resurge very quickly.
Let's switch over to this whole plan for community testing.
Sure.
And from your understanding and the discussions that you've had, how is this all going to work? And are we realistically going to see this ramping up this week?
Yeah, so before we had adequate testing, we only had the ability to do as many as 40 tests per day on Guam. So the word out to the community was, if you have mild symptoms, if you don't have any other major illnesses or comorbidities, and if you're not feeling super sick, don't come in, to the clinic. Just, to be seen. Just stay at home and isolate, and don't, really, really practice, extreme social distancing. That used to be the mantra before. that is now going to change. And we have to tell Guam specifically, if you have any COVID symptoms, if you have a loss of smell, loss of taste, if you're having shortness of breath, cough, fever, any flu-like symptoms, you need to call. You can call into the clinic first, but you now need to come in to get tested right away, because this is now a new phase, because we are increasing our testing capacity, and then now we don't have to just do a blanket suppression in terms of telling everybody to stay away. We now need to know exactly what we're dealing with and be able to understand more of what of the people in the community that are positive that we just haven't been able to capture yet. And so that's going to be an extremely important factor in our ability to reopen.
So we're going to expand the who we're testing to people just showing any sort of symptoms.
Yes, exactly.
Okay.
So the priority is still, of course, the acutely ill, those that are in the hospital. They get first dibs at what the testing capacity allows. And then the next part of this is anyone who has these type of symptoms, they have to get the rest. And included in that, when there's space available, it's going to go to the first responders. Let me back up. The only people who are asymptomatic, who don't have any symptoms, that are going to get that may get tested are potential high risk contacts of known positives, or some of our first line healthcare workers and first responders. So that's the shift right now. I know everyone's excited and talking about mass testing and drive-through testing and all that, and that will, that's something that's still being considered, and it's something that we are in the very early planning stages of that. But I want to caution everyone that you cannot mistake discussions for decisions. And so these planning discussions are coming along, but then people are hearing them, second, third hand, and then thinking there are decisions that are being made when we're still very much in the discussion process and planning process.
Yeah, you said discussions, but that was announced during a press conference.
Yeah.
So that's why we're asking about it. Like, is this really going to happen this week? And are we going to see 250 tests a day? Are we going to see?
I mean, I get what you're saying, Doc, but at the same time,
just kind of trying to clarify.
Necessarily represent what she truly meant to say. That the goal is, and so we actually know this, and this is something that we're going to talk about during the press conference today. Is what is this 250 number here? And it's actually 258. And
that's a day, right, Doc? That's what our goal is?
Per day. And the reason why that number is there is because there's a Harvard School of Public Health study that was published in the New York Times as well, that discussed that in order that they believe that in order for the country to start reopening, that every state basically needs to be able to do, every state or territory needs to be able to do 152 tests per 100,000 people. So on Guam, that equates to about 258 tests per day. At least a capacity to do that. Not saying that we absolutely have to do that many, but we need to have that capacity to do that or more. I can tell you right now that there's only one state in the union that has met that threshold, and that's Rhode Island. And the next highest is Louisiana and New York State. But we're not too bad. We're about middle. We're better than most states and territories in the country. But we do have a plan to build up to that, and it's very and it looks good, and that's why we're moving ahead at trying to ramp up to be able to do as many. Because now that we're doing the call out to the rest of the Guam, saying, hey, if you have symptoms, you need to be tested. It's no more of this, stay at home and isolate and don't get tested. No, you need to be tested. And so either you come to us or we're going to find a way to come to you. And that's where public health's main arm is. And I won't try and comment specifically on the details of how they're going to go through that. I'll let them speak for themselves on that. But that's because of this paradigm shift that we're having. We're preparing for that. And, we have a lot of good news that comes with that. For example, at GRMC, the instrument BD Max that came in last week, we had the kits come in just yesterday, and so it's going through its validation process, and that's going to hopefully come online in the next 1 to 2 days and be able to start doing actual tests. And that machine alone, theoretically could do 96 tests per day, just by itself. And DLS has the same machine. And if there was no limits on test kits and other consumables that are used up in taking the test, you combine two machines there and you supplement what Public Health Lab has and what GMH Labs has, and then we're very well on the way to hitting our numbers. And that's only and then there's still other machines that we have, the Gene Expert that's both at GRMC and Public Health Lab, that are also going to likely come online in the next either later this week or early next week. So bottom line is that we very much have the potential to not just hit the 258 mark, but surpass it by a fair amount.
So this 258 tests a day is for how many days?
Every day.
Every day.
And for how long of a period, Doc? Are we just going to keep?
It needs to be that we have the capacity to do that. And so let me explain that a little bit more. It's because not that we absolutely have to do that many tests per day, but if there's a flare-up, if there are all of a sudden an outbreak in a certain area, and that we need to be able to run those tests without delay, and none of this sitting off island and waiting 3 to 5 days for it to come back. That is not going to work in our new phase. They have to be same-day results, and so we have that. We need the capacity to be able to do that in order to sort of put these fires out when they do flame. So not that don't interpret the JIC reports that say, oh, we only tested this many this day. We're so far away from that. It's that we just need to be able to have the capacity to do that, but we still want to take advantage of that and increase the number of people that we're testing, so we cast a wider net.
Doc, I just want to go back to the trajectories again. So we had the trajectory that you put out, and now we're hearing that we're going to get another trajectory that is going to take into account all of the data that we've accumulated here in the last month or so. So I guess my question, and maybe you would know, is which trajectory are we spending all this money on? So we're spending all this money to prepare for COVID-19. Are we, preparing and spending relative to the worst case scenario with this, the 700, or the best worst case scenario with 700 deaths? Or are we now kind of readjusting what we're spending on? Because it kind of seems like we're spending like the end of the world. But now the trajectory is saying that maybe it's not the end of the world.
Can I ask a clarification when you asked about the spending? Can you give me an example of what type of spending you're concerned about?
I guess just generally, I don't have the the docs or the numbers. So what's your take on it?
Okay, just wanted to if there was a specific area of spending that you were concerned about. So first, let me speak directly in terms of like for the build-up in terms of having more hospital beds available on the island. And so what monies are we spending to build that up? Right. The reality is that right now we're not spending much at all. That these are all still in the planning phases. They are theoretical phases. Right now, in terms of increasing the number of beds on the island, we have plans to shift things around, and that we can still do so much of it if we hit a surge. That we can still do much of it still in actual concrete buildings. And we're talking about, changing Guam Memorial Hospital to be 100% COVID bed hospital, including surgery center and how it will complement, and then even using nearby hotels. So those are all part, and so we're not spending any money to transition these right away. But if we start seeing an early surge before GMH fills up, we will start getting the other parts ready. So there's no money spent in that, except for maybe just the evaluation of from making sure that these places are adequate, and then but the materials that we need to at least deal with the initial surges is here on island. So we're not ordering anything major additional. That is only going to be for to care for 2,000, 6,000, whatever patients. We're not spending, monies on that at this point. It's just it's the planning part.
Mm-hmm. What about these alternate care facilities with the FMS inside? There are 2 sites. Is that still that's still what we're looking at?
Yeah, so these FMS beds in particular, they have a fair amount of requirements to use them, and so but they would ideally still be used within actual buildings themselves. So that's why the options of some of the ballrooms at nearby hotels. UOG is brought up, Calvo's Fieldhouse is brought up a lot, but the reality is that it's very far away. It's over a 20-minute drive. And that makes a big difference when we need all when the resources are centrally located at GMH, and in terms of
I know over the weekend we saw the pictures of the National Guard. I think it's the Red Horse Squadron. They were doing an assessment outside in the parking lot.
Yes, yeah.
Right. And so have we decided where these 2 alternate care facilities?
We have Dr. Louis Cruz, who's a major in the Guard, is spearheading this process in terms of what the build up would look like, and so it's very meticulous, and it has a lot of detail in terms of when things will be triggered. And now we're not necessarily using dates to trigger because of how variable the models are giving us in dates. It's more of a trigger in terms of capacity. Once we reach this capacity in one area, it triggers the setup for the next one. But what the models tell us is also, at the worst case scenario, what rate are we dealing with? How fast might we reach our peak? And so that's what the worst case scenario is good for, is that it just tells us how quickly we have to ramp up, but we have the plans that are there, and it's an incredible effort between everybody that's part of this planning to have this drafted up, and it's great. FEMA really appreciates what's been done from the Guard side, and it's really it makes things very clear from what our goals are.
Right, I was going to say, FEMA, we call him FEMA Frank, but Frank Mansell, he was taking us through the process and how, you'll have these 2 alternate care facilities / FMS stations set up, or at least prepared and ready to go, and then they're going to bring in, I guess, the medical personnel to HHS will bring in the medical personnel to staff these.
Yes. And so that's exactly right. And there's no way, so the first thing we're trying to do is just trying to identify a potential bed space, and then the staffing part is where we would really need their help, and that's a big part of it. But I wanted to take that analogy, building up and thinking about beds, and then think about staffing. And I want to use that analogy to think about testing. So in testing, when we're talking about the ability and capacity to do tests, that's just like making sure that we have the bed capacity in a hospital. The personnel to take care of those beds, when you use that analogy with testing, it's making sure that we have the test kits and the reagents, the supplies to run those tests. So when we talk about 258 tests per day, that's just ensuring that we have the machines can handle that, that they can take on that load here locally on the island, and that right now it doesn't look like the personnel may be much of a limiting factor in terms of the medical technologists that run these tests, but it's really the rate limiting step will truly be the testing kits and the supplies that come with it, and even the supplies to take the samples.
So, Doc, we had the governor, Linda, say yesterday that they want to be able to start conducting up to 250 tests a day and more as the capacity increases. But you're now saying that that's not really the case, even though they said they want to conduct up to 250 tests a day. You're saying that it's more about having the ability to conduct that many tests a day?
Yes, and I want to be, I want to caution and I want to make sure there's no mincing of words here, that the first step in that has to be the collecting the samples before you even get to there. So what do we need to do to build up to even collecting that many 258 samples per day? So again, it goes back to the call out to the rest of the public. If you have any symptoms, you need to be tested, and you need to be tested either at one of the second tier clinics like AMC, SDA, FHP, or going to public health, any one of the community health centers, and getting tested there. And that's extremely important. So that by itself will increase the samples. and then we'll figure out how to get those tests done in the most expedited fashion possible. And the reality is that even though we don't want to send these off island, if it needs to be at least from the early phase, then we'll do that. But it's not going to be a perfect system, and it will continue to grow. And so what I really want to say is that I'm not somebody who's takes not comfortable really saying listing my credentials here, but I think it's important for the point I'm about to make. Is that aside from being an internal medicine physician and I actually have a degree in medical technology and laboratory medicine, I lease these credentials only to make the point that even for me, testing is very complicated. And I'm having a hard time myself wrapping my mind around every part of it, every aspect of this, especially in this very rapidly developing and new setting that we're in. But that being said, it seems like everyone's an expert in testing now, and the media, you guys are doing a great job trying to consolidate this and broadcast this back to the public. But it's everyone else outside of that's trying to push their agenda onto certain parts here that may not be conducive to doing the testing in the most responsible way.
Like who, Doc? Can we get some names?
Not at all. but I think it's clear that I am not a full expert on all these aspects, but given the mix of experiences I have, I play a role in this. There are other people that play a very essential role in this, and they are the best that we have on the island and close to it as actual major experts on this. And we have to rely on them, and we have to rely on their recommendations. And everyone should really be allow some patience to let this process go through, because we are in this for the long haul, and we're talking about months. And so to get excited about doing a lot of things right away is not. It's not it may not be necessary, and number two, it may be dangerous.
So basically, Katunadza, guys, just stand down. Let's figure this out. It's not all going to happen today.
And do it right.
Yes, and do it right, because the one thing we will not have on our hands is us moving quickly and then having deaths on our hands because of it.
Okay.
Right.
And so that is clear. The governor has made that clear, and so that is going to be our order of march. And so we want to do this, and because we are here for the public, we are here to do what we can to protect them. But we understand that there are a lot of other issues that we have to take into account, including the economic impact here. But the economy will never recover if we still keep adding up deaths.
Yeah.
And so
dead people can't spend money.
Exactly. And so that's the part here. And right now the drafts of and it's okay to have discussions about reopening, and that's good. We need to start planning, because it's gonna take us a while to really start peeling a lot of these layers off and figuring out. But what's good is that this task force that's focusing on reopening, they're really heavily relying on the medical recommendations on when trigger points are hit. And when check marks are made in terms of, if we do this, we can move into this section of the reopening and peel off these parts here. If we fail at a later time of meeting these things, then we roll back.
Okay.
Okay, Doc.
Are you going to be at the press conference at 1?
I am.
Okay.
All right. We'll think of some nice questions for you.
Okay, please. Softballs, please.
All right, Doc. Thank you.
Thank you, Doc.
Thank you.
Okay, God bless. Wash your hands.
All right, you too.
Okay. Okay. 7:59. Guys, we're just going to go to a real quick break, and we're going to flick the switch and jump on to KUAM TV 11. It's 7:59 again. We're KUAM FM, Hagatni, Guam, containing COVID.
Be healthy. Be informed with ITD. KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with IT&E. KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
Need a ride? Not to work. We have a shuttle vehicle ready to drop you back home and pick you up when your vehicle is ready.
Be healthy. Be informed with IT&E.
Today, we are open to serve you.
Man, they don't make them like this anymore, that's for sure.
Love it.
Good idea. Bree was like, you should play 21 because it's the 21st. 8:05. Guam's favorite, containing COVID. It's the KUAM News takeover of I-94. Of course, live here on the radio, 93.9 FM on your FM dial in stereo. Good morning. Also, we've got an audio stream on Docomo Channel 10. We're doing a live stream, KUAM.com and the KUAM News app. And we're also on KUAM TV 11 for the last half of the show. And on our KUAM News Facebook Live. Thank you so much to all of our viewers. Keep your comments and your questions coming, as it's now 8:06, and as we do in the 6 o'clock and the 8 o'clock hour, we do a deep dive into the day's COVID-19 news from the KUAM News team. Good morning, Sabrina Salas-Matanani.
Hafaday, good morning, everyone. According to the latest from the Joint Information Center released at 8:50 last night, the Department of Public Health and Social Services tested 15 individuals for COVID-19 on Monday. 0 tested positive. To date, 136 have been confirmed through COVID-19 testing, with 5 deaths and 112 recoveries. Recovery means a patient is no longer considered infectious. According to the U.S. Centers for Disease Control and Prevention, CDC research and published guidelines, a patient is classified as recovered after at least 72 hours have passed without a fever or additional respiratory issues, and at least 7 days have passed since symptoms first appeared. All remaining cases are in isolation. Expanded testing for potential COVID-19 infections begins this week. Public Health plans to go into high-risk infection areas within the villages to test those with even mild flu-like symptoms. Here's more from Monday's press conference as Nestor Lecanto asks for more information about this new community testing initiative.
Governor, earlier you said that it would be very targeted, that it would be of high risk infection areas. Could you elaborate on that? And could you tell us if it's going to, if this for surveillance testing or diagnostic, is there a difference?
There is a difference. First of all, the targeted population is really defined by public health, and maybe Linda can speak to that. But we're going out to the villages is what's happening here. We're doing a community outreach in the villages. And she's going to be working with every mayor in the villages to make sure that they have identified with the public health those areas, the mayors know their people, those areas that they feel maybe there's infection exposure there, but they're not sure, and therefore we need to test. So she's going to be working with the mayors in that sense. What was your other one, Nestor? You got me so excited about that one. What was the other question? Or the other comment?
The distinction between surveillance and diagnostic, because I think the diagnostic is what those are the results that we've been getting, right? The 0 positive out of 9. I think what a lot of people are a little concerned about is why are we not testing more, and that's where surveillance testing comes in, I believe.
Well, so it doesn't necessarily is true that if we test more, there's more surveillance. When we want to test more, we want to catch all those people that may be positive, that's not exhibiting symptoms, but they are also just as contagious as those that are exhibiting the symptoms. And so how we can find those people is through diagnosis. And that's where we then use the adequate and appropriate machine and test kits to provide the diagnosis. So diagnosis and monitoring is very, very crucial. Surveillance is more going out there and working with the community in terms of trying to find out what is the immunity out there, and maybe Linda can elaborate on that. And so those kinds of surveillance can be done through other methods of testing.
Yeah, I just want to add and reiterate that we have been testing also in addition to what we're doing at the Public Health Lab. We've gotten, and I've said this over and over, with diagnostic laboratory services. In fact, since the time of April 3rd all the way through April 19th, we've conducted 167 tests. And of that, 5 were positive and 162 are negative. And those were mainly the ones that fell below the priority criteria, those, as the governor indicated, that were asymptomatic. So we have been testing for those samples, and it's not true that we're not just limiting it just for the priority groups, and we've been doing this. In regards to the population where it's diagnostic for, again, surveillance. Surveillance is really where you have the whole community getting sample sizes and getting a representative that is an extreme sample size that would be representative of the entire population so that we can get good incidence and prevalence rates on Guam. And for right now, as the governor alluded, the only way we're going to do that is also not only looking at people that are coming to the clinics to get a test done, but also we reaching out to those remote areas, those isolated areas where we have people residing in, like, for example, in the Himlani, Gilbaza, Gilbreeze, Santa Ana subdivision, all these areas, Gilbaza and also Gilbreeze, Pagacha, Palanta, all these areas. What we're doing is we're working, I've already spoken to the mayor, the president of the mayor's council, and we're identifying areas where we know that all these individuals can be present and we'll have a good turnout, especially in these isolated areas. And of course, we've identified several locations in the north and central and southern regions, and we're already preparing for that. And if you want, I can be more descriptive, like the Santa Ana. There's a basketball court that we're planning to put out a tent and do the swabbing there. A Stumbo Gym, there's a drive-through on the back, and also Jigo Gym. In the central region, Manila and Tawini, where the homeless population resides, there is a senior citizen center there that we can do the drive-through. Agana Mayor's office, there's also a walk-through for our homeless. And southern areas, like in Agate, we have the Southern Visita, which is also a drive-through, and Jogna, which is a gym that we can also do a drive-through. So these are some of the areas that we've identified, and we're going to work with the mayors, as the governor indicated. We're already doing all the legwork and the logistics in that regards.
Conducting up to 250 tests a day and more as capacity increases. The governor says she will be listening in on the Trump administration's conference call today about reopening the American economy. She says each state and territorial governor has the discretion to decide when to reopen their local economy, and the governor says she will unveil more about her plan on Friday. The governor last week appointed an 11-person advisory team to help her decide, and when asked by KUAM whether she would be looping in former Governor Carl Gutierrez, who is her chief economic advisor for national and international affairs, she said she would be looping him in. In news from the CNMI, Governor Ralph Torres met with Brigadier General Tracy Smith, the commander of the 18th Medical Command Deployment Support, to discuss a way forward on how the Department of Defense can best support the CNMI in its response efforts to combat COVID-19. The 18th MC commander arrived on Saipan over the weekend with her team of medical planners to synchronize the needs of the Commonwealth with key medical resources. As of today, 94% of USS Theodore Roosevelt crew members have been tested for COVID-19, with 672 positive and 3,910 negative results. 4,068 sailors have moved ashore. 8 sailors assigned to the USS Theodore Roosevelt are in U.S. Naval Hospital Guam being treated for COVID-19 symptoms. One of those sailors is in the ICU for increased observation due to shortness of breath. In the meantime, Commander of Joint Region Marianas Rear Admiral John Manoni confirmed that some of the sailors who first tested negative and were moved to quarantine hotels in Tumon have since tested positive. In national news, more than 750,000 Americans have tested positive for coronavirus and over 40,000 have died. That's nearly double the number of deaths from a week ago. Today, more protests against stay-at-home orders are scheduled in several communities across the U.S., even as new virus hotspots are emerging. Elise Preston reports from New York City, the epicenter of the nation's pandemic.
In demonstrations from Washington state to Wisconsin, protesters pushed back against stay-at-home orders they say have trampled their freedom and right to work. Some practiced social distancing, some did not.
That's the facts of life. We live and we die. So to shut down the economy because of that is insane.
In Denver, an apparent counter-protester dressed in scrubs blocked cars. But a new poll from the Pew Research Center finds 66% of Americans say they fear social distancing measures ending too early, including a majority of both Democrats and Republicans. Cases of COVID-19 are now spiking in rural parts of the country. There's been a 32% increase in Oklahoma, 39% in Arkansas, 32% in Florida. Iowa saw an 82% jump, with most cases from workers at meat processing plants. At the site of the shuttered Smithfield pork plant in South Dakota, there was a 124% jump in cases last week.
Unless we get the virus under control, the real recovery economically is not going to happen.
Starting this week, New York will test 3,000 people for antibodies of the coronavirus at testing sites like this one. The governor hopes the sampling will give a clearer picture of how many New Yorkers might have been infected with COVID-19. But CBS News' John LaPook warns many of the antibody tests are unreliable.
The last thing you want is a false positive or false negative. It's better to have no test than to have an inaccurate test.
He says accurate tests are needed to slowly reopen parts of the country. Elise Preston, CBS News.
And finally, IT&E has donated 9 mobile hotspot devices with 4G LTE data to Manetlu, a local nonprofit, to help the organization carry out its mission. Manetlu empowers and educates children and families facing adversity. And that's it for containing COVID.
Thank you so much, Sabrina. 817, Guam's favorite. We just got a lot of work to do on the phone, so we're going to bring up here. They had asked for this information to be released, and I know a lot of media had also been asking at the press conference for the clinics. There was a public clinic and a private clinic in which patients were infected with COVID-19. I remember it was the governor had said she didn't want to name it. I think there was someone that said it was a need to know thing in one of the press conferences. And so Michelle from the Vigilance Committee, I might have lost her. Anyway, I got the release, so it's okay. So there were 5 healthcare settings where it appears 23 medical workers tested positive for COVID-19. This is according to a response to a FOIA request from the Vigilance Committee. Department of Public Health and Social Services response provided. Michelle, there you are, Michelle. Good morning.
Good morning.
So DPHSS provided you with this response. It was an isolation unit spreadsheet that lists the healthcare settings. First of all, I guess, did you guys think that you were going to get this information so willingly when the media had repeatedly asked for it?
Well, I always give everybody the benefit of the doubt. I always assume that somebody's going to do what they know that they're supposed to do. So, I'm always very hopeful. And luckily it worked out very well. Unlike some people.
Right, and so I know you guys have made requests, but I think this is probably the most, the information that you requested that I think would have the most impact on the public really had a right to know. And so in the response that you got from DPHSS, it shows that there was 1 person infected at FHP, 12 at GMH, 2 at GRMC, 6 at Health Services of the Pacific, and 2 at the Seventh-day Adventist Guam Clinic. Let's just go back and tell me how important do you think it is for the people of Guam to know this information, and how offended, if that's the right word, were you that they weren't forthcoming with it?
Well, I was actually very offended because the whole purpose of the committee is to make sure that we get the information out, make sure that everybody, that the government is being transparent. Which, thank goodness, we have the Open Government Law. Thank goodness we have the Sunshine Reform Act. We need to, the whole purpose of this is to protect the public. And when you give information that is pertinent to the health and the well-being and the lives of the public, and part of it is given and another part is not, and you don't even know why. Well, the reason is because, these are private companies. Well, the other companies that you listed were private as well.
Right, and so you're talking about they had named Hafa de Bingo, they had named Iglesia Cristo, they had named United Airlines, so it wasn't consistent. I totally agree.
Yeah, and not only that, but people are going into these clinics for various reasons, and not just because they think they have, COVID-19. You know, so if they are exposed to it, they really need to know that, hey, you know what, I was there. I'm starting to develop symptoms. Maybe I don't have any symptoms, but guess what? You know, I have my 91-year-old, father living at home, and I need to take care of him. And I went to this clinic because of whatever reason. You know, these people need to know what's going on. So yeah, I thought it was very. I don't understand why it was so difficult to answer the media. That should have been forthcoming anyway. But regardless, the information came out. And
it was interesting, Michelle, that the Department of Public Health released the FOIA response. Is that how it works?
I'm sorry, say that again?
So was it DPHSS that ended up releasing their FOIA response to your group?
Well, they responded to our group, and they were also the ones that disseminated all the information.
Okay. Yeah.
So we didn't have to release that information because Miss Linda DeNorsi did it herself. So
wow.
I thought that was great.
And then I want to be fair because they didn't name these clinics, and then I think the last time someone had asked about it, Linda DeNorsi had basically said that the issues of exposure were remedied and that they had run through testing people at all these different clinics and healthcare facilities, and that it kind of, this is an oversimplification of what she said, but she was basically like, that ship has sailed already, we dealt with it. She felt there was no longer a risk, and then that was part of why they didn't want to go and name these clinics.
Well, maybe the reason why she maybe she changed her mind because she realized that, maybe the public does really need to know. They are very interested because they keep asking. Yeah. When people keep asking, you got to answer.
No, I remember this during the press conference when one of the reporters kept on trying to get an answer, and it felt as though Linda was on the verge of releasing the information, and then she deferred it over to the governor because she was like, unless, Governor, you'd like to, and then it was like, nope, ain't happening. But yeah, this list is kind of interesting going through it, especially there's one here that I see, and I want to say this is the particular company that has been contracted to take Menumco that meet a certain criteria. If they don't have transportation, if they don't have a means to go grocery shopping, then they can pick you up and they can take you if this is the same company. So I think we need to make some phone calls.
Yeah.
Well, see, and there you go. See, that just proves the point why we need to know all this information.
And it also kind of proves the point why they didn't want to tell us because people were going to freak.
Yeah.
Well, people are kind of already freaking out.
Right. No.
So, and I think that this actually brings more of a peace of mind in a sense, like, okay, now I know I've been exposed. Now I know this is the situation. Now where do I go from there instead of wondering? Because I've spoken to people like, I just went to a clinic with a friend. My friend, she was the one that was sick. I didn't, I heard somebody cough. I left right away. Is this one of the clinics? And, now that spreads some chaos that doesn't need to be there. So now when we have some answers, now we can move forward with what needs to be done.
Right, and we hope this is a trend because there are things that we keep asking about, and then, we keep getting the same answer or the same non-answer. So I just wanted to bring you on, Michelle, and kind of show people that people are out here fighting battles for transparency, and in some cases they're winning them. So.
In some cases,
right.
In some cases not so much.
Yeah.
Like if you remember the last phone conversation we had with the FOIA regarding the transparency with the governor.
Right, it's been kind of lacking.
Danila Carrera.
Right.
It's been very lacking.
Right.
So that's been very disappointing considering the fact that the information that I got was basically stuff I could have downloaded myself, and not only that, but I had to pay $1.58 to get that information when I could have just gotten it for free. But that's neither here nor there.
Anyway.
So we're going to continue on with that.
Yeah. So thank you, Michelle. Thanks for coming on and sharing that with us. Okay.
Okay.
Thank you.
Appreciate it.
Be safe.
Okay.
All right. Wash your hands.
Will do.
Okay. That's Michelle from the Vigilance Committee. Yeah, good job. I'm glad that we were able to release that. And, I felt like Linda wanted to put it out. I mean, we really asked her a lot. She called the show, and she fell in her story. She said it was my decision to not tell people, and she kind of stuck with it. Man, now that's done.
I want to read through this.
I know. Bree's got some reading to do. I'm going to take a little break. We're going to go to Mungitown and speak with Mayor Alan Ugata, and then we've also got the Republican Party Chair, Tony Atta, coming on to talk about Giving credit where credit is due. All right? It's kind of funny.
Hey, man, these press releases from the Republican Party of Guam over the past few weeks.
Some
they've been-
zingers.
Yeah,
Some zingers.
some pretty good reads there.
Okay, so hey, we'll be right back. It's Containing COVID, the KUAM News Takeover of Guam's favorite.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with ITD. KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with ITD.
Hi, this is Ryan Flowers from Crescent Fitness. This is a quick public service announcement. We want to remind everyone, please just stay home. Go kick back in your pajamas, like we're doing. Go spend time with your kids. Go do the things that maybe you've been kind of just forgetting for a while. Go get a workout in. But the big thing is, please stay at home. For the sake of your kids, your family, and your future generations, please stay home. Evan, what about you?
Stay your butt home.
EU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Good morning on you. Shout out to all of our viewers on KUAM TV 11. Good morning. We're going to be playing Chamorro News in the 9 o'clock hour for our Chamorro audience. 8:30. It's the KUAM News takeover of Guam's favorite I-94 containing COVID. Let's go over to the phones. I want to just touch base in Mungie Town and Mayor Alan Gata. Mayor, good morning.
Hi, Mayor.
Good morning, Anthony.
Thank you for holding. Sorry, I know that was. I hope you have minutes.
No, I'm good, Chris. Thank you. Good morning, Alfred, Jason, and people of Guam. Alfred, how can I help you?
So we just wanted to know, your village was one of the ones mentioned with this community testing. Have you been? Have they discussed any of this with you?
Well, I know it's in the planning stage, and then of course I'm always open to working with the administration and public health, and of course the executive branch wherever we can trim the curb, like they say, and of course my people are very concerned. So if there's going to be any testing, and I welcome it to be in my center, or, if anything, the community center's central location of the village.
Mm-hmm. So what kind of conversations have you had with public health on how all of this is going to go down?
Well, that's just it. It's in the planning state, of course. So as it may, I'm waiting on the queue, and then, like I said, they outline it what available places, and of course, like I said, I have the center open, if anything. So once the plans come down together, I believe they'll be informing us how it will be going out.
Mayor, though, what are your residents saying? Because the governor is saying that nobody wants to get tested. So, what are your residents saying about wanting to get tested?
As of yesterday, I know that they were asking and inquiring where, but with like I said, with the plan in state, and when it does get implemented, I have the center open. And like I said, even myself, I don't mind getting tested. I don't mind my staff. We're first responders. We help with grab and go. We help with seniors. We help with various things in terms of getting services out to the people at the time of this need now.
Let me ask you something, Mayor, because you're saying you want to get tested. You're saying you want to get your staff tested because you're right. You're first responders. You're out there dealing directly with the community. But the criteria for testing, it seems like they're only going to be testing people who have mild symptoms. And I want to go back to what Linda had said in the press conference. I think it was one of several symptoms that are associated with COVID-19. So I guess yourself, do you have any of the COVID-19 symptoms right now, Mayor? Or are you?
No, not at all. But, I would want to lead by example. I mean, I don't know of any clusters. I would like to know what's going on. I like to make sure that even if the residents are concerned and they want to get tested, there's a place for it.
Right.
And let's get that done.
Mm-hmm. Well, public health, they announced that they plan to go into these high-risk infection areas within villages, and they're leaning on mayors to provide information on where exactly they think that they should go out and do this community testing. Where in Manila are you thinking that there may be some high-risk infection areas?
Well, that's just it. I don't know of any clusters, like I said, Bree, so...
Is there any particular areas, though, that you feel, I think we should go and test people over here?
I think it's kind of premature unless we, like I said, we just put it in the central area, and if they like to get tested, it's available for them, and they come over and get tested.
Yeah, because we just
until thus far that's what I think will be appropriate. And I think it's premature to go up and pointing out who's there. And I mean, closely netted. I mean, we have AMC as it is here in the community,
Mm-hmm.
so.
It was interesting, Mayor, because then we're asking because in the clip from the press conference, the governor put it on you guys. She was like, "Yeah, we're going to go into these areas where the mayors think that there might be clusters." I don't know. I'm all for the mayors, but you guys aren't doctors.
Yeah. Well, I don't know of any clusters to my knowledge.
Okay. Yeah. Well, have you you guys got a chance to look at the dashboard before it went live, right? And they were requesting additional information. I understand mayors were requesting information about the dashboard. Are you satisfied with the information that's on there? Just the
the mayors were concerned, and yes, I know they put it out. So that's a positive. At least they're aware. But like I said, in terms of identifying and clusters, premature. I don't have any that I'm aware of.
So you had some cases in your village, though. What were people saying? When you talk to the Manamco out there, what are they saying on the Chamorro News Network?
Well, I believe that they have all been confined to their space. Social distancing and stuff. So 14 days that's done. I believe they should be normal, out and about. I hope they're all healthy, and I just like to say take time and
Okay.
Have you spoken to any of these COVID positives, Mayor?
Negative.
Okay, so it sounds like we're still in the planning stages. We just wanted to
touch bases with you to see if you heard anything.
Are you getting defensive, Mayor, because we're putting you on the spot? Are you okay?
No. We need to pull together. We need to try to work together, and let's flatten the curve, so to say. And once the plan's instated, I'm all for it. I'm here to support the community and the constituents, and thank all those people that are out there still trying to fight this. And thank you guys for getting that information out.
Have you heard anything about what's happening over at DOC? You have any concerns about, since, the DOC is in Manila?
That's correct, but nothing to thus far other than what's already been mentioned. I know they got their staff back. They're still monitoring their posts. I believe we passed by there, so they're still monitoring the posts.
Okay. Thank you, Mayor.
Hey, you're very welcome.
All right, you take care.
You keep in touch. Shay, text me if you got something to tell us.
Yes, sir.
Okay, Mayor. I know you're just mad because Michelle's isn't open, right?
Hey, good work, and let's all get together and put our efforts and our sources together, and let's flatten this curve. It's our island. At the end of the day, it's our people.
That's
amen,
right.
Amen. Let's kill that curve, Mayor. Thank you.
Okay.
Best to wash your hands.
Adios.
Okay.
Adios.
Okay, bye.
Hey, Mayor Al of Mungie Town 836. So let's keep it on the phones and go over to the Grand Old Party, the Republican Party of Guam, with former Senator Tony Atta, who is now the chair of the Republican Party. Good morning, Senator.
Good morning, Chris. Good morning, Bree.
Good morning.
So Bree is just going to pop up this release real quick, but while we're doing that, just a little catch up here. I think the last time I saw you was at the congressional address of Delegate Mike Nicholas. Yeah, I think was that it, or was it the governor's address?
No, it was the governor's address. I was off island during the congressman's address.
Okay, so that's the last time I saw you. Man, that seems like a whole other lifetime ago, Senator.
Man, I'm telling you, you know how time flies, but you know how life changes over just a couple of weeks.
I mean, yeah, you of all people would definitely know that working in the funeral business. But Bree has this release. So Bree, what do we got?
Yeah, I just wanted to get, it says give credit where credit is due.
Yeah, definitely. And Bree, it's about giving the president credit for coming out and helping our island. And it's, just everything that's coming in now, the stimulus money that's coming in now. We have over $141 million that's coming in. We have the SBA that, over 500 businesses has taken advantage of, and that equated to about, $100 million? Mm-hmm. And then also the other funds that are available to the governor, the both direct and indirect funding. We had funds from the Department of Interior. So, all these funds that are coming into the island is because of President Trump's initiative to move forward and get our economy moving and, getting money into our people's hands. And I hope that's where the money trickles down to, is those that need the funding. Our local legislature, and local leaders there, the majority had an opportunity to turn around and give our people a hand up, right? Mm-hmm. Not a handout, and they failed to do that in this past legislature. I mean, granted, there was some bills that took care of those that are in the front lines, or everyone that's going to be getting hazardous pay. But how about our regular folks that have been unemployed for the past month and a half? I mean, these are the things that we need to bring attention to, so that we ensure that the money that comes into the island goes to the people who need it the most.
I guess, Senator, my first question would be, isn't this the nature of politics? I mean, we got, Congressman Nicholas taking credit for stuff he had nothing to do with. The governor is taking credit for federal monies that are coming down. The Republicans have taken credit for things.
Definitely, but without the president signing the stimulus package, none of that would have been possible for anyone to say, we're able to work with this and get it to our island. And that's what we need to look at, is that, we need to be appreciative for what the federal government has done so far. Our local government had the opportunity a month ago to help our local businesses before they flattened out, and they took no action. The legislature took no action whatsoever, until, a week ago they go into session, but it wasn't to address those issues that needed to be addressed. A little relief on the BPT, some on the liquid fuels tax. What is it that we can do? The stimulus money that's coming out that our local government is doing now wasn't able to be possible until federal funds kicked in.
Yeah, I mean, I agree. We've asked the governor about, bridge financing, not for businesses. I'm more concerned about the little people. But yeah, money to give them in the interim while we're waiting for the stimulus to come out. And the response we got, and she was really triggered by it too, was that, oh, go apply for food stamps. And we've seen, according to the Lieutenant Governor, that was it 1,200 people,
households, new applicants were approved.
Yeah, definitely, an additional 1,200 applicants. But again, that's a federal program. What are we doing locally? What are we doing locally for our people?
Yeah, and so,
locally.
Senator, I just got to laugh at myself because I asked the governor, what are we doing? Is there any local assistance? And Nestor asked it, and I've got every media and her cousin asked it. And her response was, local assistance is go apply for the food stamps, which is federally funded.
Federally funded, exactly.
But I think she meant in her, because I have aunties, like they say one thing and it's all malfunction, but you know what they're trying to say. That's what she reminds me of sometimes. And I think what she was trying to say was that it's available locally.
Yeah. But, but that's not the thing. I mean, we need to ensure that, because if there's additional stimulus funding that's coming down the pipeline, we want to make sure Guam is included, and you know how it is in D.C., you know how D.C. works, right? It's a dog-eat-dog world out there, and, we need to ensure that whatever funding we can get out here to Guam, we get out here to Guam. And the president can ensure that. Mm-hmm. And that's all we want to make sure is that we ensure that, we give credit where credit is due and appreciate the funding that's coming in to help our local economy. And, hopefully that the local government now will step in and say, okay, you know what, we can help out now in lowering BPT for an interim time, until the end of the year. We can lower liquid fuels tax. I mean, look at gas now is at $3.05 a gallon. If we took away the liquid fuels tax for a short period, that would be under $2, under $3. I'm sorry, about $2.95 a gallon. So it's just about what we can do to help our people locally. And since we're not doing anything locally, we need to give credit where credit is due again. And that's back to the president.
So what do you want the governor to say every time she says something about a program? Thank you, President Trump.
You know what? If that's what it takes, and you know what? I remember during the campaign season, she said she'll do whatever she has to ensure that, we can work with the president.
Right.
And if that's what it takes to ensure that funding continues to flow to Guam, then I don't see why not. There's actually no harm in it.
Right. I want to ask about. Go ahead. No, ladies first.
No, I was just going to ask. There may be some Democrats out there, some people out there that may say, Senator, it's too early for this. Why are we playing political games? Why are we criticizing, the governor on something like this, on who gets credit for what?
Well, I think this is the time you criticize. I don't think you go into an emergency crisis pandemic and all of a sudden, nobody say anything. This is where the scrutiny. Anyway,
you want to make sure that they know that the people are listening and the people are watching, and they know that whatever funding that's being spent should be accounted for. And that's where our public auditor can come in as well, to ensure that the funds that are coming down and trickling down to Guam are hitting to the people who need it the most, and to ensure that every penny that comes in is accounted for. Because we don't want to come back later on and say, where did $50 million go? We can't account for that. We don't want that. We want to show the federal government that, when you give us $200 million, we're going to be accountable for $200 million.
Right. I want to ask about this, the governor's plan to not decision to reopen the island, according to what the president had laid out. But I want to talk about this recovery council of advisors that she has. And you're talking about, maybe temporarily finagling the BPT. Given that this recovery council is, supposed to make decisions and have a plan to kind of boost the economy, do you think that this is one of the suggestions that they're going to come up with? Or do you think that the governor's handpicked group of people who are loyal to her, with the exception, I think, of Christine Boleto, who's a little more independent-minded, do you think that they would even float this idea, or they can see the writing on the wall and if we ask the governor to roll back BPT, we're going to get our head bit off, so no, keep that one to yourselves?
I think what they need to do is look at all options on the table. There shouldn't be any sacred cows on the table at this point in time. Everything should actually be looked at, everything from special funds to liquid fuels tax to BPT. Put everything on the table so we know exactly where we're at, and that when the numbers come out, that what were April's collections, that we were short now, not 10 million, but now we're short $30 million, 10 million from March and 20 from April. How is it that we can get the economy moving again? And the only way to get the economy moving again is to get these small businesses reopened, start moving them forward. And the way to do that is to ensure that we're going to give them an incentive to open up. And if lowering the BPT for till the end of the year is what it's going to take, a little bit, I've always learned that a little bit of something is a whole lot better than a whole lot of nothing, you know?
Or even a little bit of nothing.
Because right now we have a whole lot of nothing. And we need that little bit of something to ensure that our economy moves. Because yes, we are in a pandemic now, but life goes on after that. And when life goes on, we're going to need to ensure that our people are employed. We need to ensure that they're able to put food on their table. We need to ensure that they can pay their bills. Because I tell you, Chris, Bree, at how GPA, GWA has said, don't worry about water and power. We're not going to connect you today. But come the fourth month after this pandemic is over, they're going to expect March, April, and May's payment.
Right.
You know?
Well, I know, Senator, that they've said that they want to spread that out over 6 months, but that's a reality. We're seeing a lot of deferrals, and you know, when the bank come calling after all this is over, you better have the money.
Yeah, but you know, people are not only going to have to worry about water and power. It's if they have rent or mortgage, you're going to have to worry about that.
Right.
They're going to have to worry about the payment on the car. They're going to have to worry about putting food on the table. And you know what? We don't have to worry about minimum wage because right now a lot of people are not making any wages.
Right.
Sounds like we're going to see the Republicans put forward their own recovery plan and give it to the governor for suggestion.
And then she's going to go throw it in the stack where she puts all the letters from.
You know, the Republican minority in the legislature had come up with very, very good bills that have not even had the opportunity to be heard or even put on this past session agenda. And I think that did an injustice to our people. Because all they had to do is just put it on the session agenda, debate the bill on the floor, and then turn around and vote yes or no. Plain and simple.
I agree. I don't agree with a lot of those bills that you're talking about, but I think that the Democrats have made the Republicans seem more dangerous because they haven't allowed them a seat at the table. And I mean, I tell them, like, you guys are dumb because you're just making these Republicans so much bigger than they need to be from a partisan standpoint, because you have the votes, you can get this on the floor, you can kill it the way you guys pass stuff for the anyway.
Exactly, and they could have done that, right? But they didn't. So they actually did an injustice to the people by not doing that.
Yeah, I mean, some of the bills were dumb, but it's still just let them die. Let them die on the floor if they're, you know what I mean?
But and I learned, Chris, over the years that, you know, bills may be dumb, but until it's debated and heard on both sides of the coin, you know, we're not going to know what the benefits or, you know, the pros and cons of it.
Right.
And if it's not a good bill, then at least 15 elected lawmakers have turned around and said it's not a good bill for the people.
Right.
Versus a committee saying, well, no, I don't want to put that out.
Totally agree, Senator. I want to kind of go to this back to this Recovery Council. And what did you make, if you had seen the press conference, we had asked about former Governor Carl Gutierrez and his role on this Recovery Council. And I thought it was really interesting and very telling that when, was it Nestor who asked the governor?
Adriana
said, hey, who's on your Recovery Council?
Well, Nestor asked that, and then she followed up.
So she named Dr. Ricky Hernandez-Aguida, David John, who's the successful businessman that you mentioned, that he's also the chairman of the Gito board, and I believe he is running the ASC, yes. Which Bank of Guam bought, and then the Bank of Guam chair, Joaquin Cook, and then Holly, the governor didn't know her last name. She was like Holly from the Women's Chamber, which the governor helped found. And so you can see this group of Christine Belletto, I think, and you know, when I talked to her, Thane Hancock from there were some doctors, Lieutenant Governor Josh Tenorio, Chief of Staff Tony Babauta, but there was
Surgeon General
Dr. Mike Cruz. But there was one name that was missing, and that name that was missing was the name of the governor's chief economic advisor and he also advises her on national and international affairs.
Who, by the way, has had experience with Typhoon Paka, Pong Songhua, Shatta-an, the Asian economic crisis, KAL crash.
Yeah. So we want to ask you, just from where you're sitting, how valuable do you think former Governor Gutierrez's experience and know-how would be to this, not just this Recovery Council, but just the whole effort to fight COVID-19 and hopefully be able to stand ourselves up after.
I think that if the governor had felt that Governor Gutierrez would have been very useful on her council, she would have appointed him. But I think that also, at the same token, that Governor Gutierrez, like you said, he's been through so many, typhoons, earthquake, KAL crash, different type of pandemics that have gone throughout the years that he's had many experiences in, and he could have put some valuable input into how we can go ahead and start recovering locally. And in that manner, being the economic advisor to the governor, I think he should have probably been on that board. But not just Governor Gutierrez. I think we should have had more folks from the local economy, a hotel and the hotel and tourism industry.
Right.
We should have had folks from the small business owners, a few of them.
Yeah.
Just so that we can get a gauge of what's going on out here in the economy and how it's affecting our people and how it's affecting those that are currently unemployed and not bringing in an income to ensure that they can be putting food on the table for their family.
I think that's really interesting, Senator, that you as the Republican Party chair, and I know that, the Republicans have had their share of headbutting with Uncle Carl, but I think it's really telling that even you are saying, hey, yeah, this guy's got a lot of experience, bring him in. And I thought it was also telling when the governor named her council, his name was not even mentioned. Then when we asked, hey, what's up with Uncle Carl? She said, oh, I'm going to have my chief of staff call him, which is just a weird answer because you're the governor. Like, you don't have Gutierrez's number. You can't call him yourself, or you can't. And really, what I'm hearing is that that's kind of the nature of it, is that there's something with the chief of staff and the gov and Uncle Carl, and they just don't want to give him the time of day. They don't want to fold him into the discussion. I wonder if he's even been called by the chief of staff.
Yeah, and no one has proprietary rights to how to reopen an economy, right? And I think the more minds that we have at the table to ensure that we're doing this the right way and that we can build our economy from ground zero, because that's where we're at right now, Chris, is at ground zero. And we need to ensure that when we move forward, that we're able to ensure that people are getting what they need, and how can the government assist businesses to open up and start to produce revenue so that they can turn around and start collecting revenues from taxation.
Okay. Thanks, Senator. Anything else in closing you want to add here?
No, I just want to, hope that everyone is doing well out there. We're in this, and we're in this together. So I hope that, not just our local government, but everyone out there looks at how we can come together to build our economy back up. And, once again, I can't stress it anymore that we need to give credit where credit is due, and that's to the president and Congress and, the Senate, because it's their funds, it's the federal funds that are generating revenue in our economy, and we want to see more of that. And in order to see more of that, we need to be mindful of how we spend what we currently have right now, and ensure that the money that needs to get into the people's hands, and everyone just needs to be safe and stay healthy.
And wash your hands.
And wash your hands.
And wear a mask. Don't forget that.
Yeah.
All right.
And wear a mask, yes.
And thank you, Senator.
Thanks, Senator.
Thank you, Chris. Thank you.
Okay.
Be safe.
Okay, thank you.
8:54. Hey, we got to take a break. Speaker Tina Munoz Barnes is just minutes away from joining the show. She's been trying to get some tests onto the island. That's a very simple way of putting it.
Mass testing, and so
if you are supporting this idea of mass testing, and I want to go back to what Dr. Cabrera said. I love the guy, and he said something like everybody's an expert now in mass testing. Well, they're just seeing what other places are doing, and everywhere that's flattened the curve. I know nowhere in the world is really done dealing with COVID, but places where they have made significant headway into this battle against the coronavirus, those places have involved some type of mass testing. And so that's why everybody's an expert, because, we don't live in a little dark hole. People can research stuff. They can do, we didn't go to medical school, but the information's all out there.
Yeah.
So we're going to get Speaker Barnes on to talk about her efforts and the lengths that she's going to try and get some, test kits in big numbers. We're talking tens of thousands onto the island. It's 8:55 We're KUAM FM. I got any Guam. It's the KUAM News Takeover containing COVID. Say again? Yeah, the CNMI level. We're trying to catch up with the CNMI now, and that's what it is. It's 8:55. Good morning.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with ITD.
Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-78. Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafaday Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Self-storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Specialist Joshua Mansonaut here. I can't wait for him to come home. Keep us safe and stay home. I miss my daddy, and I can't wait to see him. So keep us safe and stay home.
Local Fridays this Friday. Hey, good morning on you. Our viewers on KUAM TV 11. Remember, there's just so many ways that you can help us contain COVID. We're on KUAM TV 11 from 8 a.m. to 10 a.m. On here on the radio, 6 to 10, 93.9 FM. We're streaming on the KUAM News app and at KUAM.com. There's also an audio stream at Docomo Channel 10. And, of course, with our KUAM News Facebook Live. Hey, good morning. It's 9 o'clock. So let's get Speaker Barnes on the show here. And good morning, Madam Speaker.
Manana Sitsuis, Chris, Hapaday Guam, good morning. Many of God's blessings to all of you.
Mm-hmm. So bring us up to...
Sorry, Speaker Bree just wants to get right into this mass testing. It's definitely a hot topic.
Hey, we're all excited about this. And I know this is something that you have been pushing. You wrote your letter, I think it was last week or a couple of weeks ago after it was first announced that CNMI got all these test kits. And you wrote to Dr. Mike Cruz about this possibility.
I wrote to Dr. Mike Cruz and the Advisory Council to see what we could do about mass testings and how we could ascertain that. And we had heard, that there have been test kits that have very good ratings from South Korea, and how can we ascertain them? And then the response that came back from Dr. Cruz was Guam will not entertain any medical test kit that wasn't FDA approved. In the efforts of seeing what has been handed down by FDA and the feds, we wanted to make sure that if we were going to look at this possibility of trying to test everybody in our community the same way our brothers and sisters from CNMI are doing and the efforts that they've done, I said, let's start seeing what we can do to assist and help. First of all, Sabrina and Chris, I really want to say thank you to you guys, because as we looked at the possibilities of these test kits and looking at what the federal government can do to reimburse Guam, and what we have heard from our brothers and sisters from Saipan saying FEMA would assist, you gave me some very concrete answers yesterday when you had Mr. Frank Mansell. I heard he was on, and I heard he confirmed that FEMA will work on reimbursements to those medical test kits that will be utilized. And in that same effort of following through, Sabrina and Chris, I never say, let's quit here because we're in these roadblocks, right? Leave no stone unturned. We'll continue to try and see what we can do to assist. And in those efforts, we even made sure that if these statements or these rumors are saying that all these medical test kits are going to the United States, FEMA's buying them, a lot of states in the nation are starting to utilize them. What about here on Guam, as we are a U.S. Jurisdiction? So we started to call and we started to check up, and we realized that there are a lot of areas that are utilizing medical test kits from South Korea. And I just want to say that in our efforts to continue to follow through, we even did a further letter to seek, and we found out that there are 37 companies that do medical test kits in South Korea, but only 3. One has a full accepted application from USDA, and 2 others have, I'm sorry, from FDA, but 2 others have preliminary approvals.
Yeah, this is the EUA.
Yes, and for me that was good news, because that would open up the opportunity for our island of Guam to look at and emulate what our brothers and sisters from NMI are doing to help try and test all their residents. I want to share with the both of you that if we do mass testing, it would give us a better or more accurate account of what we need to do to flatten the curve. And Sabrina and Chris, when the last several days or last 4 or 5 days, I keep hearing zero results, and though I know that is very positive news, I really believe in my heart that if we don't take the opportunity to look at the bigger picture and testing a lot more, I know that there may be a possibility that we may have missed somebody. And I think it's really important that we take that time. I know that when this issue first started, there were constituents calling us saying, we've gone to this place, we've gone to public health, we didn't meet the criteria, we got turned away. I know somebody who went to several different places, and to finally, this individual, this patient and constituent literally begged to get checked, was finally, somebody took the opportunity and saying, okay, you know what, we will test. But I don't want that to happen to anybody else. I think it's really important. I want to thank the governor and the team, Dr. Cruz and their team, for doing all the hard work out there, the first responders that continue to work every day. I want to thank you guys for bringing the information out, because if we don't try and something happens and we don't flatten the curve, or we think we flatten the curve, and we start letting people go back to some kind of normalcy, and then we get a relapse or something, that's not going to be good for our community and our just everything for Guam. And I just want to say from my heart that I will continue to keep trying. And in those efforts, I know, and I've continued to ask the advisory council with the good doctor, Colonel Michael Cruz, to please look at what is being accepted by FDA and what the feds are doing. And if we can have that opportunity to buy more test kits, let's do it. I know that there are several businesses here on Guam that have shared with us that they've asked, and some of them haven't gotten responses back yet. I cannot speak for the administration, but I can only ask through council and through the governor, request that please take the time to look at, we have the approvals that are there with the South Korean companies, and see what we can do to provide more test kits here on Guam. I know that when FEMA gave the hospitals the 2 machines, one for public health, one for GMH, 200 kits a day, you and I know that if we needed to test like that, just based on the numbers provided, it would take literally years to get everybody tested, and that's not what we want. Right. We want to be able to make sure that our community is safe, and if there's any kind of concern from population out there, from the residents out there, we should be able to look at those and get them tested. And I'm just not going to stop trying.
Yeah, Speaker, so sorry, what do you think it is? Because the governor has said that this is a dead issue, using these South Korean test kits, and it's almost like when we ask about it, and we're only asking about it because every day more people are using them. We have a story here out of CBS Baltimore. Maryland acquires 500,000 COVID-19 tests from South Korean lab. Governor there wants to test up to 20,000 people a day. We know they're in the CNMI. We know that Frank from FEMA had said that the governor did not ask for any of these test kits, and had she asked for them, in his mind, they're pretty much a reimbursable expense. So it looks like we can get them, but the governor just, she said it's a dead issue. So
I don't, Chris, I don't know if it's a dead issue. She just stated that if they weren't FDA approved, then she wouldn't utilize them. But now that there are concrete information being provided today that we have found and that we have verified, that saying that these several companies out of 37 companies do have those prerequisites that are needed, then that is an opportunity for Guam to start looking at. And I know that Dr. Michael Cruz, Colonel Cruz, has said to me that if they're FDA certified, that that opportunity will be there. And I'm just sharing with you that we've got that information. We've received it. We want to make sure, as everybody else around the world, from Italy to Europe to the United States, here in Asia, Korea, PI, China, they're all getting mass testing, going through this new journey of trying to get everybody mass tested. Then I'm hoping that the administration will work closely with us to at least start that. I understand that she shared that yesterday in her press conference, and I'm very hopeful that they will continue to move forward. I just want to share with the both of you that making sure that the verifications were there, that if they're getting the test kits from South Korea, out of 37 companies that have made the medical test kits, that only 3 have been accepted by the United States. 1 has a full-on accepted application, and the other 2 have preliminary approvals.
Okay, you're right. You're right. I think that they did say if it comes to a point where they have the EUA, like the test that we're currently using, that they would move forward with that. But when I've seen this story, there's a news story, and I sent it to Dr. Cabrera, and the response was that, oh, did you check the FDA website? Did you do this, do that? So I guess before we move any forward with this, just to let you know, like where the governor's physicians advisory group is, they pretty much want to see something in writing from the actual FDA. I mean, that's the kind of the vibe that we're getting, Speaker.
We're working on reaching out to them. We're working on calling them companies directly. We're also working with our community here to make sure everything's in order. But Sabrina and Chris, I'm not going to stop. I appreciate the fact that the administration, the governor, lieutenant governor, and her team, the medical advisory team led by Dr. Cruz, is doing the best they can, public health, all the first responders. But I need you to know that for me, the priority today is test. I mean, I'm very hopeful.
Say that again, Speaker. Say that again.
We need a test. That's the important thing this week. I want to make sure that our residents are safe, and I know that the governor wants to make sure, and her team wants to make sure that that's done. So I'm very hopeful that they will start this mass testing, and I'm hoping that with the efforts of what FEMA has given us, but more importantly, this door that's now open, that there are several companies in South Korea, 3 to be exact out of 37, that they've gotten those approvals. That has been confirmed. That is legit, that we can continue to share that. And I did share this with Dr. Mike Cruz, and we did send him a note the other day or last night, and I'm hoping that we can continue this collaboration.
So, but you haven't gotten a response yet from Dr. Cruz, right?
No, not as of this morning, but I didn't check. I'm right after this. I'm just going to follow up on all the emails and information that I've gotten from late last night.
Mm-hmm. Since they are going to begin this, I guess, mass testing, they're planning it and what have you. Have you had, are you looped in it on any of these discussions? Or the legislature, anybody?
Yeah. We did speak to the administration last week with my colleagues. We are setting up meetings and all the inquiries that my colleagues have. We are slating a meeting to happen at least, we're hoping Friday of each week until we get over this, and that's still being solidified right now. But our communication with the administration is there, and I just want to say I want to thank them for including us in their presentations. Mm-hmm. And I spoke to the governor personally yesterday.
Nice. Okay. So how was that conversation, Speaker?
It was very it was very affirmative.
Affirmative? Affirmative as in back off the South Korean test kits.
No, I know, Sabrina. I know that the governor and her team, as well as Joint Region, have been working really hard, and I'm not going to take away from anybody. This is not one time to pit one from the other, and I'm just going to say we got to all continue to work hard on this. Contrary to what anybody might say, from my heart, we need to continue to work together, and I will do my very best to work with all of them as I continue to do so and continue to give the information as I receive it to my colleagues.
Are you guys working together on the economic recovery plan? I know that's supposed to be finalized by Friday.
That was a request to the governor and asked to be that our legislature be included with the chair on Office of Finance and Budget with Senator Tilson Augustine and myself, and that was told that was going to happen.
Okay.
And I was also informed that we will have a tour of the facilities by Friday.
Nice.
Wait,
Speaker,
which facility?
Synagogues and
Oh, the emergency medical facility, and then the tents over at Naval Hospital. Right.
Yes.
Speaker, I got to ask you about Uncle Carl because we've asked a few people this morning. What did you make that it kind of seemed like the governor forgot that she had a chief economic and national affairs advisor in former two-term governor Carl Gutierrez? And do you think that he needs to be more involved and kind of looped in? And if well, just I guess answer that first. What are your thoughts on it?
Well, I'd be lying to you if I didn't say I didn't have the opportunity to work with the former governor. I was a part of his cabinet in the 90s, and I want to share with you that he is a very hard worker. And if both governors are going to work together, we'll continue to work closely with them. But I think it's important to know that during the economic crisis, during the earthquakes, during the storms, that former governor Carl Gutierrez was a man who worked really, really hard and made sure that the people realized that he was going to make sure that they take care of them the same way this governor and Lieutenant Governor are working to make sure that our community is safe.
All right. Well, yeah, that sounded like a yes. Okay, Speaker.
All right, thank you, Speaker.
I appreciate that you're not taking the no and that you're going to keep pushing this, because I just want you to know everybody that we're talking to who isn't part of the COVID-19 response. I know Dr. Cabrera said everyone's an expert, but everyone is saying that mass testing is something that we need to do before we think so.
And Sabrina and Chris, I just want to say that in order for us to reopen our economy, to make sure we come back to some kind of normalcy, we need to continue to work together, and mass testing is a very, very critical component of that. And I'm asking that they do, the administration takes the time to work closely with the approvals and see what we can do to open for more testing. The sooner the better. We have a population of 170 to 180,000, and I'm hoping that all of us get the opportunity to be tested so that we can be rest assured that we are safeguarded and protected.
Thank you, Speaker.
Thank you.
Thank you. Be safe.
You call anytime, okay?
Thank you.
Okay.
Okay. Bye.
Bye-bye.
Wash your hands. All right. Speaker Tita Munia Barnes there. 9:18. Let's take a little break. Interesting interview.
Yeah. I have to say, I remember this letter because she wrote it a couple weeks ago about this mass testing, about the South Korean test kits. And then, was it the following day or a couple days later, we got the response through Dr. Felix Cabrera, who was reading the letter on behalf of the State Surgeon General, Dr. Mike Cruz, basically shooting it down. And she's right. She didn't stop. She wrote another letter and was like, "Hey, by the way,
Doesn't
what
take
about
rejection
this?"
well. Let's put it that way.
So this is something that she has been pushing, and
Yeah.
she even has her own advisory group, which he didn't address. Where she was like, "Can I get my advisory group to collaborate with your advisory group?" And but there wasn't an answer.
Yeah,
to
they were
that.
like, yeah, nah, we're good. 9:19. Hey, let's do Chamorro News. It's containing COVID, the KUM News takeover of Guam's favorite I-94. Good morning.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with ITD.
Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafaday Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Self-storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Specialist Joshua Mansonotia. I can't wait for him to come home. Keep us safe and stay home. I miss my daddy, and I can't wait to see him. So keep us safe and stay home!
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with ITD.
This just reminds me of my kids when I tell them a song is cool and they're like, yeah, whatever. And then 3 years later, they're like, hey, Dad, you ever heard that song by The Outfield, Your Love?
I'm feeling this, man. This is nice.
Pretty good.
This is really, really nice.
Yeah, I'll play it for you later.
Oh, thank you.
Okay. 928, containing COVID, the KUAM News takeover. I wanted to bring Chief Justice Francis Tydinko Gatewood of the U.S. District Court and the Guam Bar VP, Meenakshi Hamalani, to talk about this is a really cool distance learning thing that they've put together with both the court and the bar. Good morning, ladies.
Morning. Good morning.
There's just so much legal firepower on this line right now.
All right.
Good morning, Chief.
Alpha Day, is that Sabrina?
Yes. Hi.
Yeah, that is Sabrina. So we're just going to go ahead and give you guys the floor. Can you just tell us about this cool civics thing that you guys got going on?
Sure. So it's called the iCivics COVID-19 Educational Challenge. And so our court, the federal court and the local court, and I worked with that through Chief Justice Carbolito, and the Guam Bar Association through President Jackie Terlahi and Meenakshi Hamalani, who's on the line. We've partnered together to reach out to our children who are at home going through online training and online school learning, and hopefully reaching out and looking at this civics education outreach. And so so it has a lot of educational games and lesson plans from the teachers, which will help promote civics education. And we want to encourage our students to become active citizens in our community, with all three branches of government. So we're pretty excited, and we hope that they are going to have fun with this, and we hope that they're going to be challenged by it, and we hope they win some prizes.
So you can win prizes.
Yeah, now you got Bree's attention. She was like, civics wasn't my best subject, but what, prizes?
Yeah, so let Meenakshi talk about that.
Yeah.
She can talk to you about
Sure.
how to register and then the prizes.
Okay, go ahead.
Sure, yeah, the prizes are the motivator, but basically you can register online, and this is geared towards doing things online, as this Chief Judge said, because so many of our children are at home right now. You would go to www.icivics.org, and before joining and registering for a challenge, the students need to have an active email address. So these programs are really geared towards grades 6 through 12, so if a student for whatever reason doesn't have email address, they can work through their parents. But it's either an educator or teacher or registration by a student, and they'll be asked to verify their email address through an iCivics account. And at that point, when they're registering, they have to enter a class code for the 2020 COVID-19 challenge class, and the class code is capital TAFT 71533. And then upon registration, they'll be giving an automatic generated username, and then they can set up a password and create their avatar and start playing, learning, and earning those points.
Is this an app? This is an app, or it's just a website?
It's a website where you go online, and there's a ton of different games that the students can play and learn and explore is really the purpose of this. But just to give you a couple of examples, some of the relevant games that would come up during this time, and especially with the upcoming 220 elections, there's a game called Win the White House and Cast Your Vote, where students will learn about the U.S. election system and the important role citizens play in our democracy, which frankly, come on, even us as adults, I need to learn about the election system and how it really works. And then there's other games like where students can learn to spot false news reporting and sharpen their literacy skills by playing Newsfeed Defenders. And that's important really now during the coronavirus has spread so many rumors and false reports. So I think those are important skills for our kids to learn as well.
This sounds pretty interesting, and I think that's a challenge right now anytime you're trying to engage kids with learning. So how did that happen where you made it interactive and you made it engaging, but you also kind of made it fun?
Right.
Yeah, and I think I don't think we should take the credit. I mean, we can't because we're not the ones who put the program together. But as you probably know, Chris and Sabrina, the iCivics program was founded by Justice Sandra Day O'Connor. And, she's a retired justice now with the U.S. Supreme Court, and she was the first woman to serve on the U.S. Supreme Court. And she founded the program in 2009, and I had the privilege and the honor of meeting her in 2011 when I was speaking in the Virgin Islands District Court conference. And she asked me, say, Francis, would you guys put this together for Guam? Would you be interested? I said, sure, because very similar to other students all over the United States, civics is not a required course any longer. So she felt that this was important to implement within the schools, this particular outreach. So when I told her that I would definitely try to do that, and so we were very fortunate when we had our community outreach director, Stacy McDonald Flores. I asked her if she would help put together the first iCivics camp this past summer, and it was really, really successful. And we had students come in, and it was a good test case, and now we wanted to expand that through Law Week. So we're really excited to have this program. Although we can't take credit for it, but I would definitely give the acknowledgement to Justice Sandra Day O'Connor in putting in just coming up with this particular outreach program for the entire world, not just us as a territory, not just the United States, but even in the world for students to utilize.
I'm on the website now, and I noticed you could the kids can take advantage of this, but it also looks like it's also a resource and a tool for teachers.
Yes, Chief Judge can talk about that. How the iCivics also is helpful for educators.
Mm-hmm.
Yes, so the teachers. So what's really kind of nice in our program, and Meenakshi, did you tell them what the prizes would be?
Yeah, that's
not yet. I was saving that. Sorry, I'll get there now.
Yeah,
okay, so let's get them motivated first. So the games have different time ranges. Some are 15 minutes, some are 30 minutes, some are a little bit over, depending on how much time is spent on each game. And I think the registration opened. It did open April 17th, and the last day to earn points is May 31st. So the iCivics programs will keep a playtime record and a point tracking system for each participant. So at the end, it will inform us who's ranked highest to lowest. So at the end of the challenge, we will award cash prizes to the 3 highest points in middle school and high school. First place gets $200, second place gets $100, and third place gets $50. And then there's also special gift prizes to educators with the top 3 highest class participation.
Wow, cash.
And so when you, Sabrina, when you asked about the educators, which is really nice because the educators now will be able to look at the iCivics website and put together a blog with tips from the iCivics curriculum team. And the teachers also would be participating with their students because now they would be able to use a toolkit to use lesson plans, to utilize lesson plans, infographics, games, and other free resources. And the educators will be able to take these particular games into their class period, and they'll have a detailed printable report at the end for grading. And so it's going to be like, the teachers are involved. It's not just the students on their own. It's now their teachers are involved, and the teachers also get to be motivated, as Meenakshi said, in receiving a prize.
Right.
Well, I definitely want to thank you, lovely legal ladies, for bringing all your legal firepower. I mean, this is like a
lovely ladies,
lovely legal ladies. Thanks.
Well, this is good stuff. I mean, Chris, I think this is things that, as the Chief Judge said, because they're not teaching civics in schools in a regular curriculum, this is a great time to take advantage of that.
Crazy that they're not doing that, but yeah, you're right. Let's make the most of it. Let's hop onto iCivics.org. And you could let me know if you're doing anything else that you want to get out on the radio or in the media, okay?
Yeah, I think Chief Judge, if you just want to tell them where else they can get information about this, obviously at the iCivics webpage.
Mm-hmm. Right. Okay. Yes, and you could call. I think you've seen the press release, Chris and Sabrina. You could either call Stacy McDonald Flores at 864-2269, but we also have everything posted on the District Court of Guam website, Judiciary of Guam website, Guam Bar Association website, Facebook, Law Week website, and Instagram. I think it's all over the social media.
Yeah.
All right. Thank you so much.
Thank you, Chief. Thank you, Meenakshi.
Thank you both.
Thank you, Chris. And maybe, Chris, one of your Denancies can have firepower with the legal, for the legal team.
She's dropping a hint.
We want to add it to our gift basket.
Hey, you got it. Your wish is my command.
Thank
you.
Okay,
Wash your hands,
bye.
okay?
Bye, Sabrina.
Bye.
Okay. See you, Chief. See you, Meenakshi. Oh, there you go. That's pretty cool.
All right, so the phone number 864-2269, 864-2269, or you can go to the website iCivics.org. And that is the COVID-19 Educational Challenge, civic learning through educational online games for middle and high school students and educators, and you could win some cash.
Right, and Bree's is kind of doing a dry run through it. How's your civics IQ, Bree?
Not that great.
You know who do really good at this is Nestor.
Or Jason.
Yeah.
But it is cool, cash.
I was terrible in civics in high school.
I just don't see you being terrible at
I was not good in
anything.
civics. I was not good in government. I
did okay because I always knew what the right answer was supposed to be, even though I didn't agree with it.
What, C?
Yeah.
Multiple choice C.
But hey, there is a lot of online learning going on.
Right.
And we're gonna continue to cover this as teachers are getting very, very creative and innovative to give kids the opportunity to succeed.
Yeah.
And this is another way if you want to do extracurricular.
Don't
stuff.
get Bree started because Bree is.
It's almost
okay.
I get off at 2:30. Class is in session at
That's
3
right.
o'clock.
Can we just drop an anecdote? I ran by the printer the other day here at Camp Happy, right?
Mhm.
And I grabbed some stuff, and I was looking for my own printed materials, and then I saw you had a bunch of stuff for your son. You're working on some pretty interesting homework.
He's working on some pretty interesting homework.
He had to do reviews of music videos and critical thinking and analysis skills. I'm guessing that's a pretty cool.
I'm telling you, Jay, I said don't get Bree started on this because she has some feels about her being a teacher now.
Brock is fifth grade right now, right?
Yes, he is.
He could write a dissertation paper on all the single ladies on that music video alone.
Oh. What song is that? Love on Top by Beyonce.
Yeah, Love on Top. That was
but it was somebody else sang the song. Was like a choir group or something.
And then you know what? He'd write a really good paper because we're all very proud of him. He's an amazing young man. And then he would do a TikTok video about it.
Yeah.
All right. Thanks, Jay. Go back to your corner.
Yes, sir.
9:40. Let's go over to the CNMI. And man, I feel like the CNMI's ears is burning this morning, Tomas, because everyone's been talking about the CNMI. And, I said it earlier. I think that, I don't know how it happened, but are we now playing catch-up to the CNMI and the way they're responding to COVID-19? I think some people feel that way. I'm not sure. Maybe we could, after your report, ask you about that, Tomas. But, again, with the latest from the Commonwealth of the Northern Mariana Islands, Tomas Maglotnia. Good morning, Tomas.
Good morning, Chris and Bree. Wanted to start with some of the latest news we got just a few minutes ago. Governor Torres and Lieutenant Governor Palacios here in the NMI announced the launch of a new website for the CNMI Office of the Governor. That website is governor.gov.mp. Again, that's governor.gov.mp. And I'm taking a look now at the website, and they have a page here for the latest information on coronavirus disease 2019, COVID-19. And as of the latest numbers, as of April 20th, as listed on this website, 14 number of confirmed COVID-19 cases, 237 number of persons released from quarantine, 2 deaths, and this is an updated number that we're seeing on the website, 11 number of recovered cases. Again, last we heard there were 9 recovered cases, and on this website we're seeing now that there are 11 recovered cases. Again, that website is governor.gov.mp. That was just released this morning. Those numbers coming from the Commonwealth Healthcare Corporation, according to the governor's office. Also, an update from the governor's task force: 25 ventilators, medical supplies, UV lights for infection control, and equipment arrived on Saipan yesterday from Long Beach, California. CHC is working to organize a free and open testing option. They asked the public to understand that the initiative requires a great deal of resources and planning. Before, they've also called this community-based testing. And they say that until open testing is available, to only seek care at the health tent or contact the COVID-19 info line in the NMI if you're experiencing symptoms. Again, the Commonwealth Healthcare Corporation reiterating that they will be working through the governor's COVID-19 task force to communicate a testing plan for the community. There is no finalized timeline as HCC continues to document its supplies and make their projections. We know that they're currently in meetings scheduling those plans to be rolled out to the community. We did hear yesterday, though, from the governor's office here in the NMI that drive-by testing is one of the options that they're considering. The governor's office says that they're mulling over several options, and they're also working to start scheduling those, and will let the public know when it's ready. Also, updates on the economic front in the NMI. CNMI governor will gather leadership to review and fully understand a timely, comprehensive presentation of the fiscal crisis in the NMI from April 22nd to April 27th. There's going to be an online summit with regards to the CNMI fiscal response. At the summit, they're going to assess the size of the deficit projected to be caused by the COVID-19 pandemic. One model shows that COVID-19 direct revenue shortfall is of $42.3 million with only half of the fiscal year remaining. And again, this summit is slated to take place on the 22nd to the 27th this week. It's called the CNMI Fiscal Response Summit. It's going to be held online on Zoom. Registration is being taken online. And some of the major goals they want to address at that summit is to assess the size and nature of the crisis by identifying the policy that they might enact and bring Chris, I think, also sharing with the viewers. We have plans to speak with the Public School Systems Commissioner of Education, Dr. Alfred Atta, who said he's going to be speaking with KUAM in the next few days, and also the Secretary of Labor here in the NMI, Vicky Beneventi. So that's the latest we have on containing COVID in the NMI.
Well, that's a lot.
Yeah, good job, Tomas.
This website, did the governor not have a website previous, or this is just one specifically tailor-made for coronavirus response?
So I think I reported when I first got back on island about a month ago, talking with you all, that the governor's website was under maintenance. And so this is his, my understanding, it's his general website. And if you visit it, which was just released this morning, that's governor.gov.mp. And there's a banner there that says latest information on coronavirus disease. And so when you click there, this is, you see the different cumulative numbers. And again, just looking at this website myself this morning, learning that there are 11 cumulative number of recovered cases. Of course, as we said, the last number we heard was 9, so that's up from 9.
Yeah, we're just looking at this graphic you sent over, pretty detailed. We haven't seen anything like this out of the governor's office, and really probably would be good to kind of get an idea of where are we at fiscally. There's a budget that's supposed to come out. So I think that's, again, pretty interesting that you're getting that level. I mean, it's kind of weird because they don't do press conferences, but it seems like they're pushing out information for you guys to report on. Is that accurate, Tomas, to say that? I mean, I know that that's no substitute for being able to ask questions and ask follow-up questions.
Yes, the information is coming in. That's correct, and we're seeing that, you know, even the summit that's going to be held tomorrow. I registered for it personally, and you're able to tune in on Zoom. I believe is where it's being held, and more information can be found on those socials. I think everything right now is being directed to these governor Facebook pages and governor websites, because, you know, I'm sure everyone knows now, even on Guam, that's the case, I feel.
Right, it's definitely a pivot. That's a nice way to put it.
And we're excited to talk with Commissioner of Education, Dr. Alfred Ada, because, you know, lots of folks want to know exactly what's happening in the public school system here, especially as we heard about those hundreds of furloughs and, of course, that injunction. Yeah, that was
and graduation is, you know, let's not forget about the students.
That's right. And, you know, I think I saw the local media reporting that one school is trying to plan, I think, a drive-through graduation of some sort. So, but we'll see. We'll ask him about that.
Oh, that's new.
That's strange times we're living in, to quote the Archbishop. Actually, he said strange times. Two stranges. All right, Tomas. What are you working on for today, my man?
Yeah, well, I'm just combing through that new report. You know, it's dated March 31st. It was just recently posted on that website. So I'm combing through that to look at the numbers. I know everyone's, you know, every time I've pulled in, it's been practically about the public health response. So kind of adding about the economic crisis response. I'll be tuning in tomorrow. And also, I just followed up on the 11 recovered cases. People are wondering what the process is to be confirmed a recovered case, and whether or not they go back home. Are they retested? You know, these are a lot of the same questions, you know, people are asking in every jurisdiction. So we're hoping to get answers as to, here in the CNMI, what does it take to be a recovered case, and is there multiple testing phases that they go through to be labeled as recovered? And again, that number, according to that new website from the governor, is 11 of the 14 cases labeled as recovered so far.
Right. Okay. I don't know. Can we borrow your website design guy? Because this website over here, look, I mean, I know you're not getting to press conferences, but wow, Bree, what do you make of the CNMI governor's website?
I think if you want to know about the coronavirus and what you guys are doing over there in the CNMI, you just go there, and it's got the Facebook, Instagram, Twitter. It puts out all the information on all 3 social media platforms. And then, of course, it has all the issues that they're covering, and then the message from the governor. Yeah. But definitely, if you want to know what's happening and what they're doing, because they're doing a lot, just go to this website, governor.gov.mp.
And, of course, to be fair, I want to say that while you guys have migrated a lot of information over to the CNMI governor's website, for us here in our neck of the jungle, it's dphss.guam.gov. They've set up the dashboard that has all the detailed information. That was something that was worked on by a woman who is
she's a fellow.
She's a fellow. Right. She's actually calling into the show tomorrow, so we'll talk about that. So yeah, I don't want to say like, oh, CNMI governor's website is so awesome and ours sucks.
Yeah, and you know, even I think it's still up. You know, the Commonwealth Healthcare Corporation has also had its own website,
right.
hcc.gov.mp, and prior to this new kind of aggregation, I've been going to the CHC website, and of course that's the hospital. So you know, get all the info from there too.
I like it, Tomas. I like that there's I see it, I feel it. There is something with Governor Lulian Guerrero and Governor Ralph in the CNMI. I don't know if there's a history there or if it's just as simple as the Republican-Democrat thing, but there is some tension.
Yeah, I mean, you know, was it you, Chris, who shared with me the statement from the governor's office saying that the NMI governor is not interested in a back and forth with the Guam governor? I think that was one of the statements that was made.
Yeah, and you could tell when people media here asked the governor about what Saipan's doing. I mean, you could see in her body language, it's getting her worked up, you know. So, I don't know. I think it's just a classic compare and contrast. So we're seeing what they're doing versus what we're doing here, and then we're kind of gauging that with what people are doing around the world and around the nation to contain this deadly virus.
And he's afraid. I'm just a messenger. I'm just sending you this information. Really,
here comes that Tomas guy.
Yeah, there's Tomas.
Yeah, I'm just just passing on that information whenever I can. So that's my role.
I appreciate it, Tomas. Appreciate your hard work.
Great job. Thank you.
Thank you. Have a great day.
You too, and we'll see you later. Wash your hands. There you go. 9:49. That's of course Tomas Maglotnia covering CNMI Matters for us. Let's get Jason on here.
Okay. Some funny things, because you were saying, like Kristen, there might be a little bit of a Big Brother envy going on right now between the online resources between us and our brothers and sisters up in the CNMI. But one of our top fans on Facebook, Glory Danlag Pangilinan, who has been with us ever since 6 this morning. So Glory, thank you so much for your communication. She goes, CNMI leaders, and then 5 applause emoji. Guam leaders. Let's just say it was much different emoji. There were 5 of them, but they were not applause. But but Glory has been actually very, very active in the conversation. She's been proposing a lot of ideas, and she does give credit where credit is due. And she says Gov Guam does add a lot of merits to it. But as a tech guy, I got to take my hat off and tip my cap to what they're doing in the CNMI, because like really good information, well designed, easy to navigate, easy to find, and they're doing good work there. And on Guam, they're doing good stuff too. And
let me ask you, Jay, as a tech guy, what did you make of Public Health's dashboard?
I loved it. I was actually one of the first people to get in, because if you recall, between us and our friends in print media and the other broadcast companies, we're all covering the press briefing at the same time. And Linda DeNorsi is giving like the demo and everything. So, between the 4 of us plus the governor's own Facebook page, they probably got, like 10,000 people watching at the same time. And they said, you can go to dphss.guam.gov, and everybody hit a page and they're like, it doesn't work. And I was like,
I know.
Yeah, the server fell over because, dorks like me would just be like, we're chomping at the bit trying to figure out, what the scalability thing is and everything. But
it went from the dashboard to the crash board real quick. I was like, what's going on?
Okay, and Wendy and I hate to phrase it like this considering what's gone on in the last month and a half, but when the initial surge of traffic kind of subsided and everything like that, it's really good information. It is easy for anybody to kind of like parse and pick apart. You don't have to have a PhD to be able to like make any sense of it and everything. It's good graphics. And also one thing is, remember there was that thing with the Adaloop released a WhatsApp poll service that you can sign up for.
Right.
That too had problems, but it's back up now. And that too, it's very, very wonderful, incredibly responsive, super fast. I'm hoping to do a story on that either today or tomorrow.
I just got a
on the what?
On the WhatsApp service.
Oh.
Yeah.
You can actually register for them, and you can just
I signed up for like the WHO. They had their WhatsApp service on like a.
It's the same thing. So our Homeland Security based it off of the WHO's model.
Right. Yeah. So I got my 311 message this morning at 8:24. The amount of new COVID-19 cases has been decreasing, which means that social distancing measures are working. Staying home is helping to flatten the curve.
Yeah.
All right.
But there is a lot of information out there, and it's good between those of us in private industry and the government and everything like that. They're getting the message out there, and kudos to Saipan, kudos to Gov Guam. It's, as a dork, I like this kind of stuff.
I know you do.
Yeah.
Okay. Thanks, Jay. Keep your comments, your questions coming again. It's containing COVID.
I didn't get that one.
Which one? 311?
Whatever you read.
Yeah, I got it at 8:24.
Oh, I don't have that one.
Okay, well, if I can just add again. Okay, from a geek perspective, again, the WhatsApp thing is a lot more efficient than traditional SMS. However, everybody with a phone made within the last 15 years has SMS service, so that is the most universal way to get information out. It just takes a lot longer to send it to 80,000 people.
Right.
WhatsApp is basically instantaneous. So and the website's really, really fast. Facebook is really, really fast. You're watching us in real time right now.
Mm-hmm.
Yeah, but not everybody has WhatsApp, but everybody has text.
Yeah.
Like I know people are like, hey, WhatsApp. I don't have WhatsApp. Huh? Ooh. So yeah. Okay, you good, Jay?
And if anything else, you could just get all your information on KUA.
That's where I would go.
Yeah.
9:54. It's kind of our job. Bree, can we just run through those JIC results in closing? What do you think?
Okay, 0.
Yeah.
0 from yesterday. 15 tests.
Right.
We stand at 136, 112 recoveries, and 5 deaths.
There you go.
I didn't even have to look.
Yeah, I mean, there's been a trend of 0 positives.
Yeah.
So, man, the takeaways for this morning's show, although the governor had said that she wants to test 252 people a day starting this week. I mean, it is this week, so I'm not sure what day this week. We did get Mayor Savarez on and Mayor Ongata, and according to the mayors, this is still and according to Dr. Felix Cabrera, it's still in the early planning stages. So I kind of got to wonder, is this another instance where the governor put something out that wasn't ready to be put out. I don't know.
Yeah. Well, the press conference, it's at 1 o'clock this afternoon. Dr. Doom said he was going to be there. Hopefully he's not going to be saying anything. I'm just kidding, Dr. Cabrera. But he's going to be there at 1 o'clock. So I'm really interested to see what he has to say and what he's going to be talking about.
Right, and then of course there was a discussion we had yesterday with Frank Mansell from FEMA. They're going to be releasing a new trajectory, and this trajectory is going to come from Johns Hopkins, I believe, and we should be getting it sometime in the next couple days. So they're kind of crunching.
They've got a bigger calculator than what we have.
Right, their calculators, the big,
the big ones.
So that's going to be coming out, I guess, in another couple days. Stimulus checks, yep, still waiting on those. I know that they had made some early advance payments to those who earn under $10,000 on their taxes again. For the individual payments, if you haven't filed taxes in 2018 or even 2019, you can go on our website. We have the non-filer form that we got from Daphne over at Revan Tax, and you can download that. Also, an update in case you're just joining us on the PUA and the FPUC.
Right. So PUA and FPUC, Department of Labor Director Dave Della Sola, he is supposed to be having conversations with the U.S. Department of Labor, waiting on further guidance. He was trying to submit the supplemental budget of $900 million, probably a couple more than that for the software and all of that stuff that he needs to purchase and implement to prepare for people to actually register. But he did say that it's important that all the employers that have reduced hours or furloughed people, they need to register as soon as possible so they can create that inventory, right, of businesses so that they can verify and check and when employees actually start registering. So that website is hireguam.com.
Right, and then if you're on the employee side, you can still get your information lodged there at rapid response at dol.guam.gov. Now, somebody had commented, is there an application? There's no application yet.
Yeah, they have to wait for the U.S. Department of Labor to approve all of that. So it's really just dependent on how fast the U.S. DOL makes their approvals, but just keep in mind that they're also dealing with other states.
Yeah, there's 50.
Even though some of them already have unemployment insurance.
And that's kind of it. And people were wondering what's the holdup because you see it in the comments. Oh, they're getting it in the states. Well, the states have the unemployment insurance. We don't, and so they basically had to kind of just whoop a program together.
Right, and as for the PPP and the EIDL. We're waiting on Congress to see if they're going to approve this additional package for, what is it, 200 trillion or whatever the amount is.
Yeah,
I don't know the final number, but that's what they're working on because only the current program ran out of money and only 508 businesses were able to partake in the loan, which was about $102 million.
Yeah, and so Ken Lujan from the SBA had basically said if you had an application that was completed, you might want to call over to the lending institution and find out, are they just going to hang on to that? Is their line starting over? So basically, they're going to refill that pot of money, and the loans are going to be given out, but again, it's going to be first come, first serve. So if you've send an application in, you might want to check the status of it. If you haven't, you might want to start on filling out that application, which is on the SBA. I think is it on the SBA website? They got a bunch of FAQs on the SBA website. Okay. 9:59. Hey, I just want to shout out all the first responders, of course. And especially want to shout out to the guardsmen, and I think are the Guam police at the checkpoints.
Yeah, GPD is actually the lead on it, but it's the Guam Guards personnel that are manning it.
Right, and so I know these checkpoints are real. Some people just not feeling
They're not checkpoints, Christopher.
That was hilarious to me. So I don't know what media it was yesterday in the press conference. They asked the governor, hey, something to these checkpoints, and they kept saying checkpoints. And the first thing the governor said was, I'm not calling it.
I think it was Maureen Martita from MBJ. No, he was a couple days ago.
Everyone keeps asking about the checkpoints. But it's just funny to me that the governor doesn't want us to call them checkpoints because she might get sued, and she is getting sued over it. So I thought that's interesting. What's in a word? You know what I mean?
Yeah.
And so she basically said, yeah, I don't call it a checkpoint because I don't have the legal authority to have checkpoints. But, you know, everyone else out here, I mean, if it walks like a duck and talks like a duck, whack, it's a checkpoint. Bree, good job today.
Good job to you, too, and to our people in here, Joser and Jace.
Right. And then, again, you know, one of the big pieces of info that came down from several doctors that called into the show this morning, you know, the governor is saying that people aren't presenting themselves to be tested for COVID-19. So if you have symptoms, if you've been staying home, call the clinic and find out how you can either get tested or find out, you know, what advice they have for you. I know it's conflicting. We're being told to stay home, but you're also being told to go to the clinic. So you just reach out and touch the doctors. If you want to call in and just tell them how you're feeling, if you got any of the symptoms, it's important that, yeah, we're supposed to stay home and self-isolate, but at the same time, if we're going to flatten this curve, we got to get more people tested.
Yep.
Okay, so for Sabrina Salas, Matt
Sorry, I
Sinani.
wasn't paying attention. I was
It's
reading
like, I'm
that.
used to it. Just want your attention. This has been the KUAM News Takeover containing COVID. Hey, to our viewers on KUAM TV 11, thank you so much for watching on Facebook Live. Appreciate all your comments, questions, and concerns. Hey, keep them coming.
Yep. And we're going to be back here tomorrow morning, bright
Yes,
and early.
we are. Yes, we are. It's the KUAM News Takeover containing COVID. For Sabrina Salas, Matt Tanani. My name is Chris. Leaving you with a little bit from Candyman and the cover of In Case You Didn't Know.
Hey, this was long.
Let's jam this one for you, Bree. We're KUAM FM and Agatni Guam. It's containing COVID and Guam's favorite Guahusi Chris. Adios!
Bye!
Be healthy. Be informed with ITD.